Good morning, everyone, and welcome to the webinar entitled Alternatives to Incarceration Re-entry, organized by the Executive Secretariat of the Inter-American Drug Abuse Control Commission of the Organization of American States, under the ongoing initiative on Alternatives to Incarceration, with the support of the U.S. government through the Bureau of International Narcotics and Law Enforcement Affairs, INL. My name is Elisa Rubini from the Institutional Strengthening Unit of the Executive Secretariat of the Inter-American Drug Abuse Control Commission of the Organization of American States, SE-CICAD OAS. Before we welcome our distinguished guest speakers, I will briefly walk you through some housekeeping issues. In case you lose your connection, we invite you to use the same link which you used to access the session in the first place. We encourage your active participation and to post your question using the QA option during the webinar. We will address your questions in the dedicated time. The chat is also available to post comments or share relevant information during the entire session. Thank you so much for your cooperation. We have the honor to welcome our distinguished guest who will be delivering some opening remarks. Angela Crowdy, Assistant Executive Secretary of the Inter-American Drug Abuse Control Commission of the Organization of American States, and Charlotte Sisson, Team Lead of the Drug Demand Reduction Bureau of International Narcotics and Law Enforcement Affairs, INL, U.S. Department of State. Without any further ado, I welcome Assistant Executive Secretary Crowdy. Madam, you have the floor.
Thank you very much, Elisa. Good morning, everyone. On behalf of the SE-CICAD Executive Secretariat, it is my pleasure to open this webinar on alternatives to incarceration re-entry. May I extend a special welcome to Mrs. Charlotte Sissons, Demand Reduction Team Lead, Bureau of International Narcotics and Law Enforcement Affairs of the United States. And to our panelists, Chris Watler, Executive Vice President for the Center for Employment Opportunities in New York, David Best, Professor of Addiction Recovery, Leeds Trinity University, the UK. Robin Cuff, Manager, Centre for Addiction and Mental Health in Canada. Alicia Osborne, Senior Director of Development at the Treatment Alternatives for Safe Communities, TASC in Chicago. Monica Barsanti, Head of International Relations at San Patrignano in Italy. Angela Dixon, Deputy Chief Probation Officer in Barbados. Giovanna Calderon Altamirano, Coordinator of the Restorative Justice Program of the Costa Rican Judiciary. And John Mansi, Technical Coordinator, the National Office for Persons Released, Dirección Nacional de Apoyo al Liberado, and Fernanda Feir, Coordinator of the Opportunity Network in Uruguay. Bienvenidos. Thank you all for being here today, and welcome to our distinguished audience. The SE-CICAD Executive Secretariat, in fulfillment of the goals and objectives of the OAS Hemispheric Drug Strategy of 2020 and its corresponding plan of action, is committed to supporting its members in promoting dialogue and sharing evidence-based programs on alternatives to incarceration, ATIs, with a focus on gender as a key component, thereby benefiting governments, their institutions, and ultimately the recipients of the ATI programs and their communities. Today's webinar is organized with the financial support of the Bureau of International Narcotics and Law Enforcement Affairs of the US State Department, which partners with us on important ATI initiatives. We thank you for your invaluable support. Additionally, thanks to the contributions from experts from the Americas and Europe, we will engage today in a discussion on how to develop and strengthen re-entry programs. Re-entry is a critical component for justice-involved individuals as they prepare for release and their return to society. Unfortunately, for many of them, this process is often not streamlined, efficient, or well organized. They face multiple forms of stigma, as well as institutional barriers to access employment and services aggravated by their history of convictions. This is often intensified by the limited knowledge of available programs and the unavailability of committed personnel to guide them through the process. Therefore, it is recognized that a need exists for increased understanding of the concept of re-entry, while concurrently strengthening interinstitutional collaboration to join forces and increase linkages to care services. CICAD's Case Care Management Project is one such program that promotes these values and strengthens the skills of persons working in the field. This project was developed with contributions from key international experts to develop trainings and technical assistance to promote multi-sectorial cooperation among justice, health, and social services in streamlining connections to community-based services. Through our Institutional Strengthening Unit, we have also implemented the project entitled Strengthening Therapeutic Communities and Treatment Centers in Latin America and the Caribbean, known as FOCTALI, in collaboration with the government of Italy and experts from San Patrignano communities to support and underscore the need for partnership between government and civil society in promoting social integration. In this regard, may I recognize the hard work and commitment of our Institutional Strengthening Unit, led by Antonio Lomba, and thank you to Elisa Rubini also, and Santiago Moreno here today. In closing, I am confident that today's discussion will provide food for thought and equip you with innovative approaches to foster collaboration among all relevant stakeholders involved in supporting the social integration of justice-involved individuals, in particular those with substance use disorders. Our combined efforts will empower them to navigate away from harmful illicit activities and inspire them to pursue and maintain a healthy path toward recovery. I wish you a successful webinar. Thank you.
Thank you so much, Assistant Executive Secretary Crowdy, for your opening remarks. We have the pleasure to welcome Charlotte Sisson, Team Lead Drug Demand Reduction INL, U.S. Department of State. Ms. Sisson, the floor is yours.
Good morning. And first, many thanks to the Organization of American States for organizing today's webinar to discuss re-entry for persons with substance use disorders involved with the criminal justice system. And thank you to all of the presenters that have been introduced. CICAD has done an incredible job building ATI efforts to include creating the case care management course a few years ago, creating tools to make evaluations easier for drug courts, and now looking at the issue of re-entry. This is also a very timely discussion as the Global Coalition to Address Synthetic Drug Threats launched last year and is now comprised of over 144 countries, focusing on promoting public health interventions and services to prevent and reduce drug use, overdose, and other related harms, which includes addressing populations in contact with the criminal justice system and alternatives to incarceration. Substance use disorders take a tremendous toll on the health and welfare of individuals involved, while also simultaneously undermining economic development, diminishing political and social stability for countries all over the world. Therefore, it's important to create systematic interventions which offer treatment in lieu of incarceration or further prosecution to reduce criminal activity and increase opportunities for recovery, which ultimately benefit society. Individuals with substance use disorders involved with the criminal justice system can face many obstacles addressing quality behavioral health services. For individuals with behavioral health issues re-entering the community after incarceration, obstacles include lack of healthcare, job skills, education, stable housing, and poor connections with community behavioral health providers. And this might jeopardize their recovery and increase their probability of relapse or rearrest. Moreover, individuals leaving correctional facilities often have lengthy waiting periods before receiving services in the community. And more frequently, many people return to drug use, criminal behavior, or homelessness when these obstacles prevent access to needed services. In fact, the first 3 months following release from custody presents the highest risk for return to substance use, recurrence of mental health disorders, and criminal recidivism. I'm looking forward to the panelist discussions sharing their own experience on the development of integrated pre-release planning, re-entry case management, and post-release housing, education, employment, and treatment services, which are key to re-entry programming. Of importance is also to develop programs for populations with special clinical needs, such as for women and juveniles. In addition to supporting the Organization of American States on alternatives to incarceration programming, INL also supports the United Nations Office on Drugs and Crime, as well as the Colombo Plan to promote alternatives to incarceration. I'll end with a few resources. First, that the Colombo Plan will be launching a new international consortium on alternatives to incarceration, ICAD, at the Commission on Narcotic Drugs, along with other international organizations to include SE-CICAD in March, in which everyone is invited to join, which will be able to share more best practices to include reentry. Second, INL also develops training materials for prevention, treatment, and recovery professionals that can be accessed through the International Society of Substance Use Professionals at www.issup.net. And last, that basic treatment courses are also available in an online self-guided format in English and Spanish at no cost. And this is also available on the ISIP website. And with that, I will turn it back over to SE-CICAD. Thank you so much.
Thank you so much, Charlotte, for your opening remarks. And we concluded the opening session, and we transition to our keynote speaker. I have the pleasure to introduce Chris Watler from Center of Employment Opportunity in New York, USA. Christopher Waters serves as Executive Vice President for the Center for Employment Opportunity, CEO, a national nonprofit that helps people living incarceration advance their career. As an executive team member, Chris is involved in the overall organization strategy development and implementation and provides leadership. Chris oversees CEO's national funds development and communication functions and has developed the CEO Inclusive Hiring Initiative that works to help employers improve their hiring and retention of talent with past convictions. Chris previously served as the Executive Director of CEO New York State's program. Before joining CEO in 2016, Chris worked for the Center for Justice Innovation for 20 years. He led the Harlem Community Justice Center, a multi-jurisdictional courthouse that addresses housing, prisoner reentry, and youth justice. Chris oversaw the Harlem Parole Reentry Court, a nationally recognized reentry program that helped people on parole reintegrate back into community. Chris holds a bachelor's in political science from the State University of New York College at Purchase and the master in public administration for the City University of New York, John Jay College. Thank you so much, Chris, for being with us today. Welcome, and the floor is yours.
Thank you so much, Elisa. And it's so good to be here with such a distinguished group of leaders and panelists. I'm always very encouraged when those of us who are kind of working to make our justice system better get together and talk about what works and what we can do better. So I'm here today. I'm going to particularly focus on talking about reentry courts. A lot of my background, as you heard, was in community justice, has been now focused more on reentry employment. And there are kind of common themes across all of this work around reentry, in particular, the need for us to make sure that we are coordinating reentry really when someone enters incarceration, and to begin to think about ways of having off-ramps so that we don't continually feed prisons and jails. There are kind of three things I wanted to cover today with you all. Briefly, I want to just talk about what a reentry court is, kind of a little bit about how they evolved in the US context and the kind of challenge that they are seeking to address. And the second thing is just a little bit about the efficacy of reentry courts. The Harlem Project actually had a pretty robust randomized control trial study completed on it, which for me really highlighted a set of practices and things that are important for us to consider when we are doing not just reentry courts, really any reentry program. And I'll try to spend most of my time really talking about the Harlem Project, because I think it offers a lot of important lessons for justice reform, and hopefully some questions. And I want to admit right off, like, I approach this topic not as an academic or a researcher, but as a practitioner, as someone who grew up in neighborhoods that provided a lot of the folks for our prison system here in New York, and someone whose career has been spent really working with communities, with justice systems, to try to make sure that we're actually strengthening communities and helping people and reducing harm. So I wanted to say that right up front. And I also approach this with a little humility. I know that there's a lot of creativity and innovation that occurs outside the United States. I know that there's a lot of creativity and innovation that occurs outside of systems and in communities. So I want to honor, that up front, and admit that we in the United States have certainly been on a learning journey when it comes to reentry. We are still learning, but there's some exciting things that we do know. So what are reentry courts? What are the challenges that they're trying to solve? I think it is fairly well known that the United States is really the leader when it comes to incarcerating its own citizens. And so we have upwards of 600,000 people being released to communities across the country each year. And that's just from prisons. We spend in this country about $85 billion or so on incarceration costs alone in our justice system. And, there are literally thousands of facilities across the country, a mix of federal, state, local, and tribal systems. So the United States is not only large, but it has many different jurisdictions when it comes to incarceration, and sometimes different classifications of what particular crimes will land you in prison. And the impacts of our justice system are particularly pronounced on Black and non-white people relative to white people in the United States, and also on people who are economically poor. So if you're poor, if you're Black or brown, if you're a Native person, you tend to do worse in our system. And the understanding that I have outside the United States is that you can see that happening as well in other jurisdictions. So that's something for us to keep in mind. Who are the people that are most likely to be impacted by incarceration? And because I work in the employment sector, I've been particularly focused on ways in which a conviction history inhibits someone from reintegrating back into the economy, from getting a job to being able to support themselves and their families. Here in the United States, one study found that upwards of 27% of people with a felony conviction were unemployed. And this is pre-COVID. So kind of the normal state. And we know that a year after incarceration, about half of all persons who are released from prison are unemployed. So lacking access to a job, lacking access to be able to support yourself is a huge challenge. And it has pronounced effects, not just when someone is immediately released, but if they're unable to kind of get access to the things that help you to have a job or a career, it makes it more likely that you are going to wind up back in the justice system again. I also want to highlight that these impacts are not just felt, the impacts on the justice system by individuals, they are felt by families and communities. And that cost is heavy. In the United States, parental incarceration increases the risk that a child will become incarcerated later in life. And we have about 5 million children who have parents that have experienced incarceration. And when you work at the community level, you get to see how these things play out. So it's very important for us to keep that in mind, that the interventions that we are trying to create when we talk about reentry must consider the context within which we're operating, must consider the lived experience of the individuals who are coming out or who have previously experienced incarceration. There are opportunities there, I think, to really understand those larger impacts and understand the potential leadership of people who have direct experience with the system. So reentry courts evolved in the early 2000s really as a response at the time to the over 700,000 individuals who were leaving prison at the time. And they were part of a growing effort that took root in the late 80s and 90s that were really looking at ways that courts could be more effective at actually solving the problems that courts were experiencing, not just adjudicating cases. And so particularly at the time, the emerging literature on drug courts was really suggesting that drug courts were effective at really helping people to access treatment, not to go deeper into the system. And so there was a real interest at the federal government level in really thinking about, could you apply a similar kind of judicial supervision overlay to people coming home? And so the reentry court, the definition that I have for a reentry court is that it uses judicial monitoring with community supervision strategies. So that for us, that's what we call probation, parole, that really focuses on reducing recidivism, but also promoting social reintegration of individuals recently released from incarceration. And I like to add, I think it's important that these strategies are really evidence informed as much as possible, and that they are particularly adept at coordinating the services that a person needs. And so this idea in the reentry court of judicial supervision, coordination of services, focusing on people who need more support and those who are at greater risk of returning to incarceration. And I'll talk a little more about this when I talk about the Harlem experience, but intensive, I hope everyone knows this, intensive supervision programs for individuals who are low risk of returning to incarceration are not a good idea. So reentry courts are not for everyone. They really should be focused, and any reentry effort should really be attuned to the risk and needs that a person has, and a recognition that for some people, they need some supports and might be able on their own to do the things that they need. So you don't want supervision getting in the way. Reentry courts also work by using sanctions and rewards to motivate the kind of pro-social behavior that you want from individuals coming home, like finding a job and connecting to treatment, while at the same time managing risks. And the last point that I'll make, and we see this in the drug court literature as well, having some kind of milestone of completion or graduation can be very important. It signifies that someone has achieved something. So reentry courts, similar to drug courts, also utilize that kind of strategy. So I want to talk about Harlem. The Harlem Parole Reentry Court is really a kind of standout program. So when the Department of Justice initially kind of seeded reentry courts in the early 2000s, there were 9 programs that received federal funding, and the Harlem Parole Reentry Court was one of those programs. And what is different about the reentry court is that it focused on a particular neighborhood that has a high level of correctional impact. I mean, lots of people from the Harlem community are going to prison and jails. So we wanted to use a kind of reentry strategy that was much more rooted in the community. And what that meant for someone coming home is that you wouldn't have to leave the community to report to your parole officer. Those reports, the parole officers were all located in the courthouse. The judge was there, the social workers were there, volunteers were there. And because people lived in the community, there were opportunities really to understand what someone was going through and to really work with them in a very intensive way, sometimes with their family as well, and other service providers in the community, drug treatment providers, employment providers. So it really created this kind of systematic way that folks were collaborating. The court, when it first began, we also were on our own research journey with the Re-entry Court. And I want to highlight the importance of continually kind of looking at what you're doing. So we did an implementation analysis of the Re-entry Court initially a few years after it launched. We did a retrospective analysis looking back at cases and kind of what happened. And then we ultimately did a randomized controlled trial study. So there was also a kind of learning journey around what we were doing, were we doing it the way we had intended, and what were the results that we could see, from that work. So the way the court worked is every Thursday, individuals who were assigned to the Harlem Parole Reentry Court by the State Department of Corrections were required to report to their parole officer at the court. And when someone came to the court, what they would be met with looks like a typical courthouse, but when they came in, they were meeting with their parole officers. There were also social workers and case managers there that would engage with them. So there'd be an opportunity for them while they were waiting to understand what resources were available to them. They could have informal conversations with staff at the court and their parole officers. And then individuals would, with the case manager and with their parole officer, have a court session with an administrative law judge. So the reentry court model that we had in Harlem utilized a parole judge. So normally this is a judge that you see when you are being violated by your parole officer. Instead, we front-loaded the judicial component so that the judge became a part of the care team working with this individual to make sure that they were complying with the terms of their parole and getting the kind of services and resources that they needed. When an individual came to the reentry court, they were also being assessed by the State Department of Corrections using an actuarial risk assessment tool. That tool would designate the kind of risk and needs that an individual had. And that information would be part of that person's care plan with the court and with the case managers. The role of the parole officers in all of this was to be very present with the person to make sure that they were engaging in services, to make sure that the person was being compliant with the conditions of their parole. At the same time, we were providing individualized services for them. So if someone needed drug treatment, and maybe a particular type of treatment, maybe they needed a treatment for a particular type of drug or something that was located in some place that was more convenient for them, the case management team would work to make sure that that person got connected to those services. All of this, all of this work that we were doing also required that we think about what an individual needed once they left the court. So it wasn't just you come, you see us on Thursday, and then you go away. If someone had an issue or problem, they could always come back to the court, even between court sessions, to talk to their case manager if they needed particular help, or they could call as well. The other unique feature that I'll mention that evolved over time we developed a relationship with local faith-based groups that some of them were doing prison ministries, and some of them were, they had soup kitchens in the community and were very open to working with people who had just left incarceration. So we started at the courthouse a kind of interfaith, what's called a ministry of presence. So it's not proselytizing. What it was were faith volunteers from mosque and synagogues and churches would come in every Thursday, and they would host donuts and coffee and just an opportunity for informal engagement with the men and women while they waited. And that effort proved to be a very powerful experience for a lot of the folks who came in, because these were not your parole officers, these were not your case managers. These were individuals that just saw you as a human being and were working to meet your needs. And so I highlight that because we sometimes in the justice system think collaboration with the community, we don't ever invite the community in to be a part of the work, a part of thinking with us about what the work should look like. And so, just thinking about ways in which the community can play a bigger part, I think is really important. So that aspect was happening. The other piece that I think was really important over time was really building the kind of skill that you needed the parole officers and case managers to have. So for example, we trained all of the parole officers, all of the case managers, and even the judge in motivational interviewing. This is a technique to use short, kind of skill-focused, techniques to draw out of a person how they can make better decisions, how they can address problems that they're having. And these short interventions had been shown to really help to reduce recidivism and kind of promote pro-social decision-making, positive decision-making. So we trained everyone in that. We also deployed a cognitive behavioral, they call it CBT, cognitive behavioral therapy. I don't like that because it's not really therapy. It's not being taught by therapists. It's cognitive behavioral change. So if you've ever went to a smoking cessation program or a weight loss program, or if you're an athlete and someone was coaching you and how you can, do better in a marathon, you were the subject of a cognitive change effort. And we used a particular program that had been shown to be efficacious, particularly with folks who were leaving incarceration, called Thinking for a Change. We would hold those classes at the Justice Center for the individuals on parole. And those classes were led by case managers, but we trained the full staff in what this modality meant. So it meant that the judge understood and could use the same language that the case managers and parole officers were using. So we worked to develop the team to really, by incorporating these evidence-based practices together with the idea of, helping to make better decisions about individuals. Every week, we would have what's called a micro team meeting and a macro team meeting. The micro team meeting was a team meeting among the parole officers and case managers about each case and what's happening. The macro team meeting invited other service providers who were part of our network to come in and talk to us about how things are going, ways that we could improve referrals. If people in the program were experiencing challenges, say accessing a particular treatment program, we'd invite that provider in to talk about that. That group also became a way that we vetted services. If something wasn't working and we were getting information that folks were not getting what they were promised when they went to a particular service, we would try to solve that problem with the provider. If that did not work, we would stop sending people to those services. So the judge participated in those meetings. And I think that was helpful for the judge because the judges are able to understand what the challenges are, even in the service delivery. So when they are saying to someone, you must attend the service, we want the judge to be very certain that that service is actually of high quality. So all of this kind of effort, the services, working with the Department of Corrections, kind of building a team, inviting the community in to be a part of this effort, being in the community itself and doing this work, all of that was, was a very powerful experience for the individuals coming through the program. They would stay in the program anywhere from 6 to 9 months. The majority of folks who came to the program were individuals who had very high needs for services. So these were individuals who needed treatment services, needed housing services, needed employment services. And so all of those things would get coordinated for them through the program. Most importantly, as we kind of thought about the ways to continually kind of improve this service, we began to think more about the research side of things and think about, well, what could we be doing more of to improve the program? And so that, what I mentioned before, the research journey, that was a big part of why we were doing that, to really understand how to continuously improve the program. So, what is the research on reentry courts? It actually was a survey of research that was done and released in 2017. And the results were really mixed. They looked at several reentry court programs. They found some of the programs were effective, some were not, but the program that was most effective was the program in Harlem. And I want to talk a little bit about what that research showed and why it was important. So we conducted a randomized controlled trial study of people. So folks were either who were from Harlem, were being sent to Harlem, or they were being sent downtown. The parole reentry court didn't serve everyone that was coming to Harlem. There are lots of people that were coming out. So the department, that was easy to do. The Department of Corrections, we worked with them to randomly assign folks. We conducted a set of structured interviews, both with individuals in the reentry court program and individuals outside the control group outside of the program. And we looked at data on individuals who came to the Harlem Parole Reentry Court and individuals who were in the control group. And the recidivism outcomes were impressive. So rearrest, the parole population at Harlem were much less likely to be rearrested than the control group. Reentry court parolees were significantly less likely than the control group to be reconvicted within 18 months. And as you may know, that most people, when they fail after incarceration, it happens usually within the first year to 18 months. And the difference was 22%, which is pretty robust in any kind of social intervention. Felony reconvictions demonstrated a 60% reduction. So here again, the highest risk individuals with the highest felony crime levels, actually the reentry court was better in Harlem with them than the control group. We also looked at revocations as in our context, certainly in New York at the time and throughout the country, parole officers and parole agencies and probation agencies, they make decisions about whether or not someone is in compliance. And if you are not in compliance, you can be returned to incarceration. And those revocations account for a big percentage of individuals returning to prison. So the thing that we know from this is parole and probation officers are not great at actually determining who is at risk. And when they are making those decisions without any evidence-based decision-making tools or supports, you are going to wind up sending more people back to incarceration, thereby increasing their risk and making it harder ultimately for them to reintegrate, not to mention the increased costs. And this has no connection to public safety. So these the years of sending people on parole and probation revocations back to prison have not resulted in safer communities or reductions in crime. So we know that it actually doesn't work well for folks. But that said, so it was important to see how this program, how the reentry court in Harlem was actually affecting that, because the revocations played such a big role in what could ultimately mean someone being returned to prison. And the good news there is that compared to the control group, reentry court participants had a 12% revocation percentage, the control group 22%. So the relative difference was a 45% difference. That is very robust in our world. Usually if you can get 5%, 10% difference, that's considered very successful. So we were very pleased to see that. But the evaluation pointed to some other things too that I wanted to highlight quickly. One is that reentry court participants were significantly more likely to report school enrollment or employment. So this is on the structured interviews. The quality of employment was also higher. They reported more than double the control group average of work hours, and were more likely to have jobs that had health insurance and other benefits and paid days off. Additionally, reentry court participants were more likely to report that they were earning more income than individuals in the control group. Substance use, they were less likely to report using drugs. 65% indicated they were not using drugs at the time of the interview. Only 39% of the control group stated that. So similar to drug courts, we think that this effort was helping people to not use drugs, kind of addressing this important health need. And very importantly, the reentry court participants also felt more connected to their family, more engaged in supporting their family compared to the control group. And so that, those things for us are very important. More likely to be employed, more likely to be connected to your family, more likely to not be using drugs. All of those things were, for us in Harlem, were very important, in addition to the reductions in recidivism. So it was fantastic news. Why has this worked? What is it that worked about this? And for any of you thinking about deploying a reentry court, or just thinking broadly about your reentry practices, I will leave you with the things that I think are important. It is very important to have real coordination of services. How you do that? We did it in Harlem. Reentry courts do it with judicial monitoring, but similar to any effort where you're dealing with an agency and authority, the agency and authority has to be willing to share some of the decision-making with others who can play a role in actually helping the person. So it's important to focus on that and on success. The other thing that I thought was very important is members of my staff. So when I started in Harlem, no one on my staff had ever been to prison. And by the time I left, about 20% of the staff. One individual in particular, who essentially functioned as a clerk for the court, was a former participant who we became a volunteer with the court, and then we hired him. I hired him to actually work in the program. And he had been in and out of prison for 40 years. And so he came out, he was older, he was tired. He came to the reentry court in 2001 when it opened. He failed. He went back to prison. He came out again, and at that point it stuck. So my friend Kramen, who I tell his story with his permission, really served as the court's clerk. He became a trusted case manager in the program. And it was, to this day, very inspiring to me to see how his presence in that program really helped the clients in the program, sometimes who would be discouraged and thinking they couldn't do it. They couldn't succeed in their treatment. They couldn't receive in their recovery. They couldn't get a job. Then we'd introduce them to Kramer and say, well, you should talk to this gentleman and stuff. But it was also the trust that he developed with the judge and with the parole officers in particular. The team meetings that we would have sometimes, it would be the parole officers who sometimes would be arguing to give someone another chance in the community. That was beautiful. So when we saw that, we knew that things had changed. So think about ways to involve people who have had direct experience in your programs, in your work. They can really make a big difference. And then, the other things that I'll say is, it is important to have a good sense of how you're using incentives and sanctions. You want to make sure that you're kind of acknowledging behavior, and that can be as little as a judge congratulating someone on a milestone. That can be a sanction, can be saying to someone, well, we're going to adjust your treatment because we don't think you're taking it seriously. And to try to do all of these things in the community. So wherever possible, to try to avoid using additional incarceration as a sanction. And I already talked about kind of the involvement of volunteers, but I also have to say, just this idea of procedural fairness is also important. When someone came to the reentry court, they were heard. They could talk about their frustrations, in the court session. They could talk about it with their case manager. And when we did the research, we saw very robust differences in the perceptions of fairness among the reentry court participants relative to individuals who were just going to the regular parole system. So when we run and operate programs and court processes that are fair, we are going to get better results and outcomes. So I'll stop. Elisa, I want to be respectful of time. At least my clock says I've been talking for 30 minutes, which is a lot for me. So I'll stop there and see if there are any questions, maybe.
Thank you so much, Chris. I think we were all entangled into your speech, so we don't mind you keep speaking if you think that there are some other things that you want to cover. We do have time. I think you touch upon a lot of very, very interesting points that have a lot of connection with some of the work that we are doing as SE-CICAD with the case care management and the work that some colleagues are doing in their respective cities. So I'm reading a comment from Uruguay colleagues that they are saying thank you for your presentation, and they will be very interested in assessing the study, the research that you mentioned. If you can provide us with some link and resources, I'm sure that that's going to be very, very interesting.
Absolutely.
I don't see right now any question in the question and answer chat. Oh, yes, I see that David raised his hand. So I'm going to turn to David Best, which is one of the speakers of our roundtable. And I will properly introduce you later on, but please jump in with your question, David. You're always welcome.
Well, thank you, Alyssa. I didn't know whether I was allowed to ask a question or not, but I thought I'd just persevere. So, Chris, I thought that was fabulous. I really enjoyed that. So thank you and congratulations on that. In my area of work, which is primarily about recovery from addiction, we talk about the social contagion of hope and that peers play a fundamental role. And that whole process of social learning and role modeling is absolutely critical. It's been much easier in recovery services, in my experience, than in justice services, where typically the model tends to be risk averse and don't reassociate with anyone who's got criminal histories. How do you manage to overcome that perception that this is somehow unsatisfactory and unacceptable from a justice risk perspective?
I appreciate the question, David. It is something that I deal with every day in the employment sector in particular, right? So the stigma, the myths about a criminal conviction or addiction, these things are present huge barriers for folks. So lots of employers won't have trouble hiring people who have convictions because of perceptions. And within government, I mean, our federal government just, we passed a few years ago a fair chance hiring law for the federal government. They just produced rules, so the rulemaking is over. So now the federal government has a fair chance hiring. And it'll be interesting to see how that's implemented, because I think it is, you do confront that stigma. When I first approached my colleagues at the parole agency about having Cramen join the team, there was some reticence. Folks were kind of like, wait a minute, he was a client. Won't he do this? Won't he do that? What about this? What about that? I think you try to start small. You try to get get an intern, like start at a small level. And increasingly, a lot of justice agencies are having trouble hiring people. So I keep saying to them, like, you should really think about some of your former clients. If you've been really successful, you could have some great folks. And I think I always use the treatment community as an example, because that community is very driven by peer support models. And I think those models can work very well. The last thing I'll say on employment, we had a few years ago, we were looking at young adults in our employment program and realizing they weren't doing as well as older folks. So we started a credible messenger mentoring program here. And there were group meetings. There was a curriculum that used some cognitive change elements to it, but it was led, we hired a group of staff who were all justice impacted. The difference between young adults going through that program and young adults that were not at my organization were big. There was much bigger dosage of program completion, better employment outcomes. And the young people themselves were reporting that they had a better connection to the mentors. The mentors helped them to work through problems because they could call them anytime. Your job coach, you can only call when the office is open, but your mentor, you could call at any time. Those strategies are kind of a super vitamin for any kind of criminal reform effort, in my view.
Thank you so much, Chris, and thank you, David, for the question. I also would like you to elaborate a little bit more, Chris, on the initiative of the inclusive hiring. I think that you mentioned some of the connection with how you can create this synergy and helping company appreciate people that are transitioning. So I think that this is a very, very important aspect of your work, very unique how you engage with them. So if you can give us a little bit more of how you, since you build the program, it's just inspiring to learn more about it. Thank you.
Yes, we, all of the work that nonprofits, NGOs do to help people get jobs are on the supply side. You get people training, you get them supports, you try to prepare them for interviews and help them to get resumes together. It's all on the supply side. For people with convictions, though, and they are the biggest pool in the United States of marginalized workers. Over 70 million people have a criminal conviction, and they are effectively kept out of many of job opportunities. And we can't afford that in the United States. We have a real demographic problem where our population is aging. The population that is growing up are fewer. And so we're having a worker shortage that is going to persist. It began actually before the pandemic, and it will persist for the foreseeable future unless we figure out how to bring in marginalized talent. And before anyone thinks that AI is going to solve this problem or some other technology, it is not. We don't have enough truck drivers, for example, even though that's a job that a lot of people leaving incarceration could do with training if they got the training to do it. So we, a lot of those companies that use drivers are hurting. They can't find drivers. So at my organization, Center for Employment Opportunity, we have a bunch of what we call mobility experiments that we are running to kind of help people access better jobs. The work that we've done on inclusive hiring is to say, well, wait a minute, what can you do on the employer side? Because what's happening is that the employer practices are a big barrier. Why do those practices exist? Employers have been socialized all through mass incarceration to think that people with a felony conviction are not great hires. I had an employer tell me once, I won't hire anyone who's a murderer or a sex offender. I just won't do what I want. I said, why? It's like, because I don't want them to, be around my people. I worry about them. And, they recidivate. That was his perception. I said, well, actually, they have among the lowest recidivism rates of people coming out of prison, which was news to him. That's not what he understood. And I gave him examples of employers that had hired individuals who had been convicted of a sex offense or a violent crime and how well they were doing. And then he tried it. And then he hired more people. And then, but it took that kind of effort with him. So what we do in our inclusive hiring work is we offer to come into companies to look at their HR, their talent practices, how they're hiring. Background checks are a big deal in the United States. So when you're hiring someone, you can get their background, and that can force you to make different decisions, even if the person is otherwise qualified for the job. So we want to train employers how to balance information about someone's background with what they're seeing from the applicant, and to consider the rehabilitation that a person has done. So if someone left, everything that we know about people who leave incarceration suggests that incarceration is basically a young person's game. You tend to become more engaged in the system, and we can talk about why. I'm not blaming young people. I'm just saying when you're younger, you're more likely to be incarcerated. You're more likely to go back to incarceration. But that falls off precipitously once you get past 25, 26 years old. And people who have been in the community for 5 to 7 years, have the same risk level as someone who's, a similar person who's never been to prison. So we do it in our work on inclusive hiring with employers. We try to help them to understand the actual science and what it says. We work with them to change their practices. And then some of that work, we have been doing work with some platforms. So we developed with LinkedIn the first course for job seekers with a criminal conviction. It was taught by my colleague, Dr. Jenna Reimer. So that course is now on LinkedIn. It's free. It's available to anyone who has a conviction and wants to know how they can find a job. And then we've been working with Indeed.com, the biggest job search platforms, on how they can use their platform to better connect people who identify as being justice impacted with employers, and particularly employers who are interested in hiring them. And so all of that, we do a lot of education work around that, some consulting work with employers. We're very excited about it because if we could get the top companies to open up more jobs, you literally automatically create millions of job opportunities for folks with conviction. So, that's the work that we're engaged in now.
Thank you so much, Chris. Really, really inspiring. And it's great to know how you are working, not just on the supply side, but on this demand side. And I think that's really needed. And there is no much knowledge about how to engage with them. So I think all this information proves really, really useful for all colleagues working in the field. I encourage, if there are any other question specifically for Chris or any aspect that you want him to elaborate further, to send us a message either in the chat or in the Q&A session if it's a question specifically. Antonio, please go ahead.
No, just a brief mention. Just, I mean, really, the work that you're doing that you did in Harlem and in New York particularly is amazing. We had the chance to visit it a few times and bring people from the region to visit, the course and the re-entry model, etc. So I just wanted to congratulate you for the great presentation and work. Thank you.
Thank you, Antonio. And if I could make one plea, it is that we know a lot more now, and there's a lot of evidence on what we should be doing better. I think the challenge for us who actually have to do the work is, how do you do it? How do you have the resources? What kind of strategy and tactics do you need to deploy? The parole reentry court in Harlem got better. It didn't start there. So I just want to encourage folks. Someone might be saying, well, oh, we could never do that. We could never do this, but you can. And as you think about the evidence-based practices that you could use or want to use, work collaboratively with others, have a plan for how to deploy those practices. Sometimes the practices are not practical for those of us who actually have to do the work every day. See if there are ways to be creative in thinking about, well, what can we learn, from a practice that could drive us? Maybe it is that you can do motivational interviewing. Like, you can train your staff in that because it's easier, simpler. You may not have an actuarial risk assessment tool, but there are factors that you can look at, like age, number of prior convictions, these things, to begin to kind of assess someone's risk. And the last point that I'll make is just the importance of treating people like human beings. I cannot tell you what it is, what happens to someone when they get treated like a human being, particularly when they come home from prison. The biggest concern when we survey our folks here, my organization, they are most concerned about how people will think about them. It's the reason that they come here, because they know that we know their situation. They also know that our employers know their situation. They're not going, that worry falls away. So just keep that in mind. When we would do the volunteer, the faith-based volunteer in the courthouse, some of the new guys would sit and they would look, and they were curious. What is this thing? And other guys that were waiting would say, hey man, you can go get some coffee. You can go get some tea. You can go. Said, really? Like, that's for us? I remember this one guy was just like, that's for us? Just hadn't been treated that way and stuff. So I would just point to that as important. And I would say to any judges in the audience or parole officers, you matter a lot. How you are, your temperament, your willingness to learn, to be open, is so important to success of any effort. And I know that can be challenging at times, especially, I think judges sometimes take a lot of convincing. But the thing that worked for me is that I would get a colleague judge who knew this and did this work to talk to a new judge. So, so that they were talking together. And again, if you're building a more collaborative kind of justice approach, you're going to have those relationships. So there is a lot of blocking and tackling, as we say in the United States, when you're trying to do any reform work. But don't be discouraged. It is possible.
Thank you so much. Thank you for sharing also this sparkle of hope, and for bringing in that we do have evidence of what works. So the challenge is now is how we can indeed make the services better and replicate. I'm reading to the comment on the chat, and there is a lot of interest about the study, about whatever you can share about what you are doing. I will collect the information, and after the webinar, I will pull together a reference. So for all the colleagues who are interested in sharing something to the participants, so that we can all learn more about it.
Absolutely.
Thank you so much. Thank you for the passion, the inspiration, and the great work that you are doing each day and every day with serving these people.
Thank you, Elisa. Take care, everyone.
Thank you so much. So I think that, we do have a question now.
Okay, I'm still here.
There is a question. If you could elaborate on whether your organization approach individual businesses, or did they go through an established business group like a chamber of commerce?
Yeah, I appreciate that. We have worked with some individual companies, so JP Morgan, for example, in specific markets in the United States. And then, yeah, sometimes we are approached. It's fairly new work for us. We've only been doing it for a couple of years. We do a lot of business development, so we go out and we make presentations. We work, for example, with the Society for Human Resource Management to create they have a Getting Talent Back to Work initiative that focuses on people with criminal convictions and hiring. So we help to develop the content for that. So that's another way that we try to create opportunities for employers. And then we do make presentations to local chapters. We actually, someone mentioned Chamber of Commerce. We are talking to a couple of chambers of commerce as well. I think it's very important to listen to employers. They talk differently than those of us who are NGOs. So I always tell my staff, you can't walk in and start talking about cognitive change and all this other stuff that we were talking about today. That's not how employers think. So it really is kind of understanding their challenge from their perspective and then helping them to know what works and what they're doing that might not be working for them. And then developing a relationship and guiding that relationship, helping them to build their own knowledge, but they want practical solutions to hiring. And the thing that I say to them is, you got all these folks right now that want to hire, your competitors are hiring them. The question is, do you want to? That's totally up to you.
Thank you so much. Chris, I think I don't see any other question right now. I see a comment in the chat from Antonio. Thank you, Antonio. That is an excellent presentation. And I totally concur. It's a great way to start this conversation today. And thank you for sharing your experience with Re-entry. Thank you so much, Chris.
Wonderful. Yeah, enjoy the rest of the meeting. Sounds like it's going to be wonderful.
Thank you so much. So I think we transition now to the roundtable discussion, and I have the great pleasure to transition to the second part, where we will have different experts. But I just want to take few minutes to maybe wrap up some of the highlights from Chris' presentation. He was mentioning the importance of creating this collaboration, this sectoral, multi-agency collaboration with different kind of institution. And from SICAD, we strongly believe in the importance of this model. As Angela Crowdy was saying in her opening remarks, we developed and support the case care management, which is a model that brings together different stakeholders and enabling this collaboration in a system that streamline evidence-based practices in determining people's strengths and needs and in facilitating the access to treatment and social integration services. We developed the manual in English and Spanish, both for participants in the training and trainer manual, so that we can support countries in creating this multi-sectoral system to facilitate the access to this program. Both manuals are available on our website, and if you are not familiar with it, we encourage to visit the website and have a look at the manual. Case care manager contribute to every intersection of the criminal justice continuum. So it's not just applicable on re-entry, but also on all the other intervention in the alternative to incarceration during the pre-trial, during the trial, post-trial, and also in the re-entry services. So with that, I have the pleasure to rekindle the topic to the re-entry specifically, and to introduce the excellent expert that we have with us today and will participate in this roundtable discussion. So we have Professor David Best, which is Professor of Addiction Recovery at the Leeds Trinity University in the United Kingdom. We have Robin Cuff, who is Manager at the Center for Addiction and Mental Health, CAMH in Toronto, Canada. We have Alicia Osborne, which is a Senior Director of Development, Treatment Alternative for Safe Community Task in Chicago. We have Monica Barzanti, who is Head of International Relations in San Patrignano, Rimini, Italy. We have Angela Dixon, which is Deputy Chief Probation Officer from Barbados. We have Giovanna Calderon Altamirano, who is the coordinator of the Restorative Justice Program of the Judiciary of Costa Rica. And we have the team from Uruguay with John Mansi, that is the Technical Coordination or the National Office for Person Released, DINALI in its Spanish acronym, and Fernanda Sphere, Coordinator of the Opportunity Network Uruguay. So welcome, everybody. What a magnificent panel of experts. And I'm just gonna briefly go through the dynamic of this roundtable. I will introduce each speaker, and they will have 5 minutes to present themselves and have a brief overview of the work they are doing in connection with recovery. So without further ado, I leave the microphone with our first expert, David Best, to introduce himself. David, you have the floor.
Perfect. Thank you so much, Elisa. And I should just warn everyone that when I asked my question of Chris, a little caption appeared on my screen which said, "We're not sure what language you're speaking." So people are always astonished when I say English is in fact my first language. And in fact, it's my only language. I'm just not very good at it. To quote the great Scottish comedian Billy Connolly, Glasgow is a regional accent, not a speech impediment. So if you don't understand me, I apologize for that. So I wanted to pick up on a couple of Chris's comments before I started. And desistance-like recovery are strength-based processes. So I think we have to think it slightly differently. And there's a couple of big challenges that present. So one, we have to move away from the notion that it's something that happens inside a body or a head, and that it's fundamentally social and located in environments. And I think one of the huge challenges, loads of my work's about recovery, is that we can't replicate and reproduce in the way we would with traditional methods. So if we produced the perfect detox, it wouldn't matter whether we were in Glasgow or Lisbon or New York, it would be the same. But it doesn't work for a recovery model or a strength-based model because they rely too much on some of the things Chris talked about, social role models, connections, pathways, opportunities. And I think we have to think slightly differently about how successful innovation is reproduced, because it can't simply be replicated. And it creates opportunity, but challenge. So anyway, that's not what I'm supposed to be talking about. Background. So I am a university researcher. I'm chair of the Prison Research Network for the British Criminological Society. I'm a founding member of the College of Lived Experience Recovery Organisations in the UK, and I'm kind of as much an activist for recovery as I am a researcher and an academic. Nonetheless, over the course of about 15 years now, I've gathered 3,500 recovery stories. And so I'm in a really lucky position. I get to witness and measure some of those things over time. And I just can't emphasize enough that something that Chris mentioned, which is so important, is the role of peers, the role of inspirational figures that are, like, in our world, we talk about the social contagion of hope. and the social transmission of recovery from one person to another. And there's two ways of framing this. If you wanted to know what the secrets of recovery are, they can be framed in two ways: jobs, friends, and houses, or somewhere to live, someone to love, and something to do. It's, you know, the science of it is much more sophisticated, but effectively that's kind of what it boils down to. And both of the projects that I'm going to briefly mention and that I mentioned to Lisa really stem from those two things. They stem from that model of jobs, friends, and houses, and the central role of peers. So the first is a project based in HMP alt course, which is in Liverpool in the UK. And it starts with a 1 day at a time project where peers who are former prisoners in HMP alt course go back in and they deliver 12-step programs one-to-one in cells. And it's been highly effective and really important, but that's not really the key point of this. The key point is they are also the through-the-gate agent. In other words, having built up that radius of trust and that relationship, they then meet the person at the gate on release and get them into the recovery community. No opportunity to stop off at the pub or to meet your dealer. It's straight to the recovery community. And the aims there are get people involved in sport, art, and recreation, employment training and education, recovery mutual aid community groups, and volunteering and active community engagement, and if necessary, recovery housing. And it's been incredibly successful as a model, but the other thing it does is it creates the helper principle. It becomes a cycle of giving back, and people get their first role in recovery organizations as the prison-based helpers. So it becomes a cycle that generates opportunity, volunteering, and employment. Second example is in America, and I've been very fortunate to do a lot of work with the Virginia Association of Recovery Residences, and we do a lot of work around implementing recovery capital measurement. And there, I was really fortunate to be able to visit a jail in Virginia called Chesterfield County Jail, which runs a HEART program, Helping Addicts Recover program. I'm not quite sure how Americans do it, but every program has an acronym. I frequently think they come up with the acronym and then design the program afterwards. But anyway, that's an aside. So this is just wonderful because it's a genuine democratic therapeutic community in a prison. So when the sheriff took us on our visit round, he said that he doesn't decide who goes into the TC in the jail and who comes out. That's decided by the other people in the program. But what is crucial about this is a continuity of care program. So when people graduate from HARP and leave the jail, they go into one of 3 recovery residences in Virginia, where they can stay for up to 2 years. But, and the thing that amazed me is, they continue their therapeutic program by going back into the jail on either a weekly or a 2-weekly basis. They continue to participate, but they provide that sense of what is possible after you leave to the current prisoner group. And so it creates that genuine social contagion of hope. And what we found was, and the other thing that I think is crucial, is Virginia got some extra state funding for people who had low recovery capital on release from jail to provide more intensive support in the form of peer coaching, intensive therapeutic support if they needed it, transportation to mutual aid groups, transportation to justice appointments. And we've just completed and published our paper on this. They caught up the gaps in recovery capital within 6 months, and their retention rates on the intensive program were as good as people on standard program who'd had higher levels of recovery capital to start with. And we've both of those programs, the continuity of care program and the intensive support program, have been published and written up. So these are now clear evidence things. So these are studies from opposite sides of the Atlantic. What do they show? They show the importance of continuity of care. They show the central role of peers and the importance of pathways to increasing chime, connectedness, hope, identity, meaning, and empowerment, by allowing people that opportunity to give back and creating a system where peers aren't just one-off volunteers. There's genuine pathways into training, employment, and careers for them. So I don't know if that's sufficient, Elisa, as a starting point.
Thank you so much. That's excellent as a starting point. Thank you. And I reiterate that we are really, really interested in receiving the list of any materials and resources that you can share about your work and the work that you've been associated with. So we appreciate that. Thank you very much.
Thank you.
I now give the floor to Robin Caff from CAMH Toronto. Robin, you are very welcome.
Thank you so much for inviting me, and thank you for the speakers ahead of me. I suspect there will be a lot of overlap and repetition, which is very affirming. And there'll be little nuggets of differences, which is also very valuable. So I just realized as I was sitting here, I'm entering my 25th year of leading addiction treatment and social services programs. So yeah, I'm old and experienced. But I'm going to focus in on the Toronto Drug Treatment Program that I've been leading for 12, 13 years, something like that. Drug treatment courts around the world have very similar principles, but some of us have very different ways of following those principles and different focuses. I will say that the Drug Treatment Court program in Toronto is not focused so much on abstinence and meeting judicial requirements. It is focused on trauma-informed care. It is focused on harm reduction, and it is focused on integration from the beginning of the program to aftercare and beyond. I will talk a little later about complexity, which we are all about. I will say that for us, integration needs to be experienced, or integration efforts need to be experienced in safe and supportive environments where mistakes and false starts and starting again can be turned into learning and therapeutic opportunities, and where individual abilities and system challenges are taken into account. We do very much a stepped and individualized process. We have intensive case management. And yes, as has already been indicated today, our peer support worker who completed the program years ago is front and center to the reintegration efforts. We focus on client-led goals, and yes, some programs and judges and crowns or prosecutors, got to do language that everyone relates to, have their own goals, but we work very hard at realizing that a client will follow and pursue goals that are theirs. And often we can find the connection between the program goals and the client goals. We focus on things being achievable. We recognize that goals change. And as I've mentioned, we work with complexity and individualization. So we have broken down, when I first came into this business, reintegration was 3-4 things people always said, housing, employment, pro-social stuff. And of course we focus on those things, but we have broken it down into tiny pieces and a stepped approach. So in the beginning, we're looking at health and dental care and food security and income support and transportation and pain management and following schedules and getting identification for the 25th time because it gets lost or stolen. Finding out what family relationships are about. And for us with harm reduction, really focusing on medications and safer use practices. But throughout, which is basic to what we do, is building therapeutic rapport. We talk about, we help with bank accounts and physical health and mental health assessment and treatment, literacy, cooking, shopping, life skills, socialization, communication, leisure activities, self-help, mutual aid, immigration issues, which is huge in Toronto, safety planning. And as people go along in their progress, things like job fairs, volunteer work, pre-employment skills, faith-based connections, resume writing, computer skills, employment training, parenting skills, and things like that. I think that, and we also use existing community resources, even though we have wraparound services and provide a lot in-house, and people, especially with complex issues, require one-stop shop. That's the best model for most people who are complex. We also use existing community resources such as housing and income supports and literacy training, cultural services, parenting instructions, mutual aid, specialized groups, gender-specific groups, trauma services, business community. One of our most fun things that make clients feel they can integrate is we have a corporate volunteer program. So at least once a month, sometimes more frequently, we have corporate volunteers, organizations who want to have a social impact or want to say they have a social impact, who come in and play sports with our clients, and they get education, and the clients just feel, hey, I belong. And that sense of belonging gives them confidence. In closing this section, I will say that we focus on not being shame-based, focus on things not being linear. This is often not a linear process. And we focus on what I call the deposit and withdrawal system. When we ask change of clients, we're asking to withdraw from their personal resources. We're asking them to do something very difficult. And when we encounter kind of a brick wall or resistance, we go back to making deposits into therapeutic rapport, deposits into relationship, deposits into hope and assistance. And every client is different on the amount of withdrawals that they can tolerate. And so just like bank accounts, we have limits to, some people have a limit of how much they can take out, a limit on all sorts of things. We figure out those limits with our clients, and we just stop and say, okay, now we do deposits all the way through, but sometimes they've reached their limit. And so we just focus on deposits. Thanks.
Thank you so much, Robin. Very inspiring. Lots of content squeezing in this minute. Thank you so much. I will now turn to Alicia Osborne from Task. Alicia, you have the floor.
Good morning and good afternoon to everyone. It is such a pleasure to be here with everybody. David, I love what you said about, someone to love and somewhere to live, right? Because the humanistic part of this work is something that could be so easily overlooked because the systems could be so challenging. So it's such a pleasure. My background, just very briefly, I am a licensed clinical professional counselor. I'm also a certified rehab counselor who specialized in vocational educational employment in New York City. I loved hearing our opening plenary and very much appreciated that the employment focus of this population with reentry is just so utterly important for the purpose-driven essential ingredients of reentry and overall recovery. I am here today representing the organization which I have worked with for 19 years, Task. We're located in, our headquarters is in Chicago, Illinois. We are a statewide not-for-profit agency. I'm going to focus today mainly on two different components of our work, two different program of direct services. One is going to our acronyms that were mentioned, is what we call at TASC our ACJS system, which is Adult Criminal Justice System. That does include our problem-solving courts and our sort of statewide case management, specialized case management work that we do across all 102 counties in Illinois. And then our second acronym of the day is our CTP programming, which is our correction transition programs. And I will get more detailed into that because recently we have received some federal funding, and we will be starting an enhancement and an expansion program based on gender-specific responses for women in our Illinois Department of Corrections systems. So basically, TASC has been in operations for direct service delivery for nearly 50 years. The components of our specialized case management is the foundation of our service delivery across most of our programs. Our 5 main divisions of service delivery at TASC do include the adult criminal justice, our youth and family, our corrections. We do provide SUD services at the intensive outpatient and outpatient level. And we're also involved in deflection services, housing and employment services. I think all of the growth that we have experienced over nearly 50 years really is client responsive and what's needed to be an effective supporter of someone who is going through and impacted by the criminal legal system and all of the challenges that that could face, and addressing and connecting individuals to all of the essential services that they need to thrive in their communities. The TASC adult criminal justice system work that we do is founded in our specialized case management model. We are available to anyone in any of the county jails or any part of the court system who we could go in and assess either in community and in county jails and complete a comprehensive assessment that will be looking at primarily, does this individual have a substance use disorder? And then we're taking a very advocacy, strength-based approach with our partners, right? Presenting to the courts that this is an opportunity. There are alternatives for this person to get engaged with in the community. We position ourselves to be part of that stabilization and reentry process for the jail. And it was mentioned by Chris. So in the United States, we do have 2 distinct systems. Our county jails and our Illinois State Department of Corrections are our prison system. And in this, TASC will do an assessment, and then we assign a specialized case manager who is with them throughout their journey at TASC. We are looking at building as much recovery capital with the individuals that we're working with. Bless you, David. And making certain that individuals are immediately connected leaving a county jail. As soon as we could get someone to that next juncture, that next access point of care is our goal. We have incorporated drivers in our programming. Even if a program is 2 blocks away, David, you spoke a little of this, it's very easy to make a 2-second decision and be in a place of that may get you rearrested and right back where you were. So we really try as much as possible to meet our individuals at the jail discharge, be able to get them to that next place of juncture when transportation may be a problem. And the rural, urban, and major metropolitan aspect of the state of Illinois is very challenging for people. There's some places where capacity and community resources are very sparse, and there's other areas where there are multiple different opportunities for people to engage in services. And with that, I just speak, it was referenced before, and I love the affirming comments from everyone who have spoken so far, but the need for true and authentic partnerships, true and authentic collaborations, including working with one another on mutual service agreements, on MOUs, on things that truly commit you to doing what is going to work for the target population that we are choosing to work with. We need places that will receive our clients when they are able to get there, right? These are not traditionally Daytime, 9:15 a.m. in USA time referrals. These are in the middle of the evening. These may be in very typical after hours referrals that are coming based on when someone is released. And we need to build those capacity relationships so that when someone is available and we could bring them somewhere, that there is an entity that will receive them. I very much appreciated the humanistic and the dignified way of treating the individuals that we're working with. Our clients are in systems where they become different numbers for the most part, right? They're an IR number, they're a Mr. So-and-so, they're a couple of digits, they're a first initial and possibly a last name or vice versa. And all of those very simple but extremely significant mannerisms that could happen in these settings truly make a difference and can assist an individual in engaging. An example of that is even entering a courtroom, and if it's the morning time of good morning, so-and-so, these individuals have a name. If it is the afternoon, if someone didn't show up or they were late, I appreciate that you're here. You know, those sorts of things help people change their behavior. There is a lot of behavior change that is necessary when someone is trying to cease and reduce their substance use. So our specialized case management does involve an assessment on everyone that we're seeing. These referrals can come to us via a mandate from a judge, from a public defender, from an individual themselves sitting in a county jail and saying, I would like a task assessment. A family member could call and with appropriate consent, ask us to reach out to somebody and we can assess someone that way. And we try and get that assessment done as soon as possible so that the advocacy can start on that individual's behalf. We would do the assessments are all based on, of course, DSM-5 and ASAM level of criteria. And we are letting whomever was the referral source, letting them know what we plan to do with someone. That includes making certain we have a confirmed referral for someone, the intake date and time, where they are going, who their assigned task case manager will be. And again, we're with them throughout the time that they're with task. All of the referrals, main priority referral there is substance use disorder and getting them into the effective level of care and the appropriate dose of treatment that is required. We are also dealing with all of the other essential service needs that this population has: unstable housing, food insecurities, health insurance issues, making certain that they have their documentation, making certain that their family members know where they are with appropriate consent, all of the different things that come up when someone may relapse, making certain they're in an additional level of care and wrapped around with the additional support that somebody needs to continue their journey of recovery. A little bit later, I will be sharing some more detailed information on the Correction Transition Program new opportunity that we just received. It is federal funding that comes from the Department of Justice, the Bureau of Justice Assistance. Pleasure to be with you today.
Thank you so much, Alicia. Wonderful. And I take this opportunity also to remind the participants that they can post their question in the Q&A and we will address them in the dedicated time. So I will transition now to present our next expert, Monica Barzanti, Head of International Relations in San Patrignano, Italy. Monica, welcome.
Thank you, Lisa. Thank you to all the staff of ES and SE-CICAD for organizing this amazing event and for the passion that all the speakers of this panel are putting into the discussion. I mean, I see that commitment and engagement with the population we are working with is such a high level, so inspiring. I heard Chris speaking and David and you, Alice and Robin, everyone is really dedicated. We have differences, of course, in our work, but we all want to put people at the center of our work. So this is the meaning of considering and looking at people with a different vision. They are human beings with problems that we can help and support to solve, but they still are human beings, not addicts, not detainees, not prisoners, but people, human beings with a great value and talents that they only need to rediscover and learn to spend in their life. So a short introduction of my work, my organization. It is a residential, long-term, drug-free center that welcome people since 1978. So it is 46 years that we welcome people. 26,000 people have been provided with a home, the warmth of a family, the opportunity to resume the abandoned studies if they want, or to learn a trade, to learn professional skills in order to be able to re-enter into society later on at the end of the process as contributing member of it. I think that this is the key issue. We have to support these people through this process. Recovery is a process, it's not a goal per se. It's something that goes along with relapses and difficulties and problems, but this is life, you know, life also for people with substance use disorder problem. I think that we all here agree on the fact that prison, unless a very special one like the one described by David, prisons are not the appropriate place for people who use drugs. So decriminalization is one of the element of advocacy in many countries, and already in many countries, in Italy since 1975, actually, use and possession of drug for personal use is not a crime. But unfortunately, people who use drugs commit crimes anyway in order to fuel their substance use disorder or under the influence, or anyhow, they commit crime and end up in jail anyway. But that's why ATI are so important, alternative to incarceration. And it is important in this discussion to find out which are the best alternative to offer them. So we studied at San Patrignano our population. We find out that vast majority of them had a very, David would call it a very low recovery capital. So they have low level of education, very low level of employment. The vast majority of them never worked or lost their job because of their substance use disorder. So we have to invest and to understand that this is the way through. We have to support their going back to society as contributing member. At San Patrignano, we have a study center in which people can resume the study, but also we provide them with trainings and professional skills so that they can get certification in order to be able to be reintroduced into society, so that they can be citizen at any effect, without stigma, without difficulties in being part of society again, because they are strong enough and they have the skills to and self-esteem to be welcomed into society. Another information that many people share in this discussion is the value, the importance of peers. At San Patrignano, most of the people of the staff are former residents, people that in many cases completed their personal experience as a recovered person with appropriate studies in order to be able to work as a trainer, as a carer, as staff members of the community, which is, as I told you, composed and managed mainly by peers. Another important thing that I would like to underline is that we welcome also people coming from jail. As I told you, in Italy, there is a law that allows people to spend into recovery services, treatment program, according to their choice, up to 6 years of jail. Instead of being in jail, they can apply to the judge to start a different, an alternative to detention. So in this year at San Patrignano, we changed it into recovery program more than 4,000 years of jail. So more than 10% of our population has a problem, is in conflict with law and needs an alternative to detention. When David said that the recovery is based on strengthening of strength and overcoming barriers, this is I think the focus of our work. People already know all too well how weak they might be, how many mistakes, how many difficulties, how many barriers. They know all of that. We need to focus on their strength. We need to help them to see that they might be strength. They have talents, they have strength, that they only need to discover that they have it, learn to practice them. That's why at San Patrignano, the program is a long-term program, because we dedicate the first phase to improve their relational capacity, to improve their ability to stay with other people, to relate with them, and to learn accountability and self-esteem. Then we pass to the second phase, in which they can get some skill, some professional skill or study, in order to have some concrete tools to go back to society. But what is important is to look at people with a different eye, with a different vision. They can do great things. They can really make the difference in society. I read some studies by David Best, our Professor David Best, that said that most of them do voluntary work in society. Normal, let's say, population spend, 40% of them spend time into voluntary work. More than 70% of people who are in recovery spend time in voluntary work. So this desire to give back give us the dimension of the change that these people has gone through. Because when you are on drugs, when you are on substance, you think only about yourself. But when you finally find out that there is a different way of living, what is important for you is not money, is not concrete material thing, but is the relation with other people, is this opportunity to give back to other people. So I think that these people really deserve our attention and our help and our support. So that's all.
Thank you so much, Monica, and thank you for touching so many aspects and connecting with colleagues. I will ask for a little bit of indulgence to our speakers who have not introduced themselves already, but I would just to follow up with a question specifically on the barriers that in social reintegration to Robin, because unfortunately she needs to leave. So I want to make sure that she can present all her great experience, and at CAMH they are dealing with with people that face multiple complexity, not just substance abuse, but also mental health, and that's a unique perspective. And I would like her to elaborate a little bit more on which kind of intervention they use to address these multiple difficulties. So thank you, Robin, and you have the floor.
Thank you, Lisa, and I apologize. I love your format and I'm ruining it. You know, often our clients will say things like, I want to be normal. And that's a lot about what they consider to be reintegrated. But when complexity, and I'm not in the game of comparing and trying to say that we serve the most complex, But I will say that we only serve people with complexity. When complexity is inherent in people's lives, and the community and system responses create barriers. So just to give you an idea about our program, we only turn down people for acceptance if they don't have severe and persistent substance use, and if they don't have a high needs and high risk of recidivism. We don't take people at the low end of the spectrum. So just to put that in context, a typical client profile would be between 10 and 30 years of substance use, using crystal meth and or fentanyl quite frequently, having multiple overdoses in the past year, being homeless or precariously housed, having no or very little family connection, having between 10 and 30 years of criminal justice involvement, having multiple brain injuries from early childhood, having no recent reliable work or housing history, having concurrent mental health diagnoses such as anxiety, depression. We have so many people with undiagnosed or untreated ADHD, often the stimulant users, goes hand in hand. Bipolar, increasing psychosis, active psychosis when they are in our program, multiple medical concerns, and not just simple PTSD, but complex PTSD. I know the people on the call know these people too. We are not unique. What I'm saying is these are the only people that we take. So as I said, our approach is staged. When you have somebody with chronic, severe, persistent drug use, and we don't take anyone who just uses alcohol, just uses marijuana, or just uses both of those substances. So basically it's stimulants and opioids, and usually the street and poisoned supply. We have a number of deaths. So the drug use is high risk. And also, and I think that this is important to put in context, we live in a harm reduction city. I think that's really important to point out. Our context is a harm reduction city with safe injection sites. Our program is co-located with our addiction medicine program, where methadone and Suboxone and Sublocade are offered freely. And when I say freely, they don't have to pay anything for it. I don't think I've met a client recently that doesn't have a concurrent, we call them concurrent disorders. I know in some context you call it dual diagnosis, but a concurrent mental health disorder as well. Trauma and brain injury are probably the biggest thing. So we zero in on that. If we are not providing our services in a trauma-informed environment, and some of you have heard me do presentations on this, the rule of thumb is to focus in, treat everybody with trauma-informed practices because it won't hurt anyone. But if you don't treat them in trauma-informed practices, then you can hurt people. And also recognize that trauma symptoms are often misdiagnosed as mental health issues. They're misdiagnosed as non-compliance. They're misdiagnosed as having motivation. Often people with severe trauma do not respond with what people think are the appropriate emotional responses. So somebody may laugh when something's serious, and while that could be an inappropriate response, it also may be a trauma response. And then when you add brain injury onto it, or FASD, you have people who say yes, 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 and even in the moment, they can repeat what they're supposed to do, and then they don't follow through. And so there's this misperception often that that's because they don't want to, they're not compliant, those types of things. And sometimes it's because they cannot So we need to tease that out. You know, our clients also, we are finding that, you know, 55-year-old clients are more like 70-year-old people. The cognitive decline is huge, and that really impacts their ability to get jobs, for instance, and their ability to be hired and to maintain. They mostly have severed connections, so they don't have a family to go home to. Chronically homeless, and the stigma and discrimination is huge. They face it everywhere, and so the opportunities, as you all know, the opportunities are so limited, and the ability to follow through are limited. I am not painting a picture of lack of hope. We hold hope with our clients. What I'm painting a picture of is smaller steps, longer periods of time, more supports. First and foremost, always building that therapeutic rapport, like I said about the deposits and withdrawals, always being trauma-informed and creating safety. For us, being harm reduction, we call it infused. Believe me, we're not the warriors that say harm reduction is the only way. We are the advocates that say there's a continuum of care. A lot of advocacy around the stigma and discrimination, modeling boundaries and healthy connection, focusing on meeting basic needs, addressing the criminal behavior and thought process, adjusting for individual ability, which means we have to do a lot of assessing and reassessing, individualized and redefining success. It's not necessarily the standard expectation. We look at functionality as one indicator, like how functional can you be in your home, in a volunteer job? Are you stable on medications? Are you taking opioid replacements regularly? Can you establish some connections? How can we help you with the difficulties of connections? I will say that we model connection. Our motto is DTC, connected. Our judge regularly has a motto that says, I am not ever asking for perfection. I am only asking for connection. Because we know that people don't change outside a connection, a healthy connection. We work on clients feeling a sense of purpose, being able to set goals and break them down, connect it to the various helps, reducing their crime, volunteering, social activities, life skills, daily living skills, and creating a sense of boundary, but all within that therapeutic, trauma-informed environment. Thanks.
Thank you so much, Robin, and thank you for being with us today. We know you have to leave, so in case there are any additional questions, I will bother you after the webinar. We'll reach out per email so that we can respond to eventually afterwards. So thank you so much.
I will stay for the next 5-6 minutes.
Okay, wonderful. Thank you so much. And thank you for the other speaker for their patience in the sense of fairness. I will move ahead, and it's a pleasure to have Angela Dixon, which is Deputy Probation Officer from Barbados. Thank you, Angela. You have the floor.
Hi, good morning, afternoon, depending on where you are. I am going to have a little different perspective. My presentation isn't going to discuss those persons who are engaging in substance abuse programs. Rather, we in Barbados, which is 166 square miles, have come up with some innovative ways to deal with the re-entry process. So first, let me tell you a little bit about myself. I have been at the probation department for 24 years. I've had the privilege of coming up through the ranks. I was an officer and a senior and now deputy, which means that I would have worked every single court on the island. I would have worked and done pretty much every report, everything. So I think I'm fortunate enough to have a well-rounded perspective of what persons go through when they engage a probation officer, what it looks like at court, what it looks like when you go to prison. So I am grateful that I've had that experience, which helps to helps me in my job to formulate policy. Saying that as well, another interest that I have been working on a little bit of research with respect to the social construction of masculinity in Barbados, taking into consideration the colonial aspect and how the development of an individual's life. I'm focusing specifically on males because in Barbados, males are most often the victims and perpetrators of crime. So I looked at how the family, pairs, and institutions shape and impact the use and acceptance of violence. And also the idea behind that is to look to see how we as a culture construct masculinity, the acceptance of violence, and how we can put programs and policies into place to change that so that it doesn't become that accepting. And yeah, I'll leave that there. So, because I could go off on a tangent on that. I will talk about what we do at probation. So probation does not have a system of parole. So what has happened is that probation department has filled that void by offering what we call prison aftercare and welfare support services in the prison. So we have 2 officers who are assigned to the prison, but I should back up first and say we only have 2 facilities, 1 adult facility and 1 juvenile facility. So we have 2 officers that are assigned to the adult facility. And with respect to the welfare aspect, if you went to court that particular day and thought that you were going home, but you didn't, the welfare officer would come and see you while you were there, ask you, is there anybody we need to notify? Were you renting? Do we need to get your things packed up? All those kinds of things, so that we assist you with respect to that. If you are also a sentenced individual and there are issues and challenges within the community that you're not able to deal with, for instance, you could have a child that's not going to school and you've heard that they're having issues and challenges, the officer will meet with the persons who are taking care of the child, and try to put mechanisms in place to offer some assistance. With respect to aftercare, what we do is before you're ready to be released, we come and we interview you. We ask you if you know where you're going, what your plans are when you are ready to leave, and we ask you whether or not you want to participate in our aftercare program, which means that what we will do is we will do an assessment with you, we will do a reintegration plan with you, and we will talk about your long-term, medium, short-term plans, where you're going and what you're seeking to do. So that is what we do with respect to parole. It is a voluntary, completely and totally voluntary, but we find that we have quite a few people who are interested and willing to participate in the program, and we monitor you for a year after you're released. After that, with respect to the juvenile facility, most, I would say about 95% of the persons who are in the juvenile facility would have come through probation first. So our juvenile facility is your last stop, your last resort. That means that you have exhausted all other social services, and that's how come you've ended up there. Because we would have worked with you for such an extended period of time, we recognized that there was a gap before, because what would happen was once you were committed to the facility, that was the end of it, and you didn't have any contact with your probation officer anymore. And 9 times out of 10, you would have been with that officer for at least a year or 2 years. And we found that just abandoning them when they went into the facility was a form of trauma. So what we did is we have now an MOU with the juvenile facility. And what we do now is when the child is committed to the government industrial school, which is what it's called, within a week of committal, the probation officer, the welfare officer at the facility, and the child sit down and come up with a plan. What is it that you're going to seek to achieve during the time that you are serving your sentence? And the officer is required to maintain contact with that child once a month for the duration of their sentence. And that contact could be something as simple as calling the officer and saying, are we having any challenges? Or if there are issues and challenges that were happening within the home before they were committed, doing some mediation with the parent and the child and doing some programming with them so that when the child comes out, they're not going back into the same environment that they left. And that is what we do with respect to parole, reintegration and parole at probation. Short and to the point.
Thank you so much, Angela. We appreciate you being conscious of the time and helping us moving along. Thank you so much for the richness of your experience, and thank you for filling the gaps that you see were in the system and doing your best to stretch the resources to address that. Thank you so much. Voy ahora a cambiarme al español para poder presentar a nuestros ponentes que nos acompañan de América Latina. Es un gran placer darle la palabra y presentar a Joana Calderón Altamirano, que es de la jefatura del programa de justicia restaurativa de Costa Rica. Giovanna, muy bienvenida, tienes la palabra.
Muchísimas gracias, Elisa. Muy buenos días para todos y todas, o tardes si están en otras latitudes. En primer lugar, agradecer demasiado a Elisa, a Antonio por la invitación y la posibilidad de que Costa Rica pueda compartir con ustedes lo que venimos trabajando, pero además el poder escuchar y ser parte de estas experiencias creo que es sumamente importante para todos nosotros quienes estamos en este trabajo diario, ¿verdad? De buscar alternativas al encarcelamiento a la vez que la recuperación y la reintegración de las personas en la sociedad, que a pesar de que han cometido un hecho delictivo, no quiere decir que debemos de dejarlos ahí como depósitos, como lo mencionaba una de las personas anteriormente a mí, ¿verdad? Sino que muchas veces llegan a estar en la cárcel precisamente o a estar en contacto con el sistema judicial porque la misma institucionalidad no le ha dado las oportunidades necesarias para tener otro camino en la vida. Entonces, con esta pequeña introducción les cuento que cuando yo estaba iniciando a trabajar como fiscal del Ministerio Público y en ese momento fiscal en menores, una de las preocupaciones más grandes era cómo aseguro yo que estoy dando la oportunidad de una suspensión de proceso a prueba o de una sanción alternativa a una persona que realmente la va a aprovechar y que realmente va a poder cumplir con esa alternativa que se le está brindando. Y con una no muy grata experiencia, uno de mis primeros casos en donde un chico que le estábamos dando la oportunidad con una salida alternativa para no llegar a la etapa de debate, muy prontamente empezó a incumplir, tuvimos que revocar y tuvimos que ir al debate y las consecuencias ya propias de esta etapa procesal. Posterior a esto, un par de años después, inicia en Costa Rica lo que en ese momento se le llamaba el programa de justicia restaurativa. Y es ahí donde podemos encontrar ventajas a lo que sería un procedimiento de una salida alterna o de una sanción alternativa al encarcelamiento, asegurando un abordaje integral, asegurando un mayor índice de cumplimiento y dándole también a las víctimas una voz y un voto dentro del proceso. Entonces, esto nos permite en Costa Rica el tener un abordaje multidisciplinario en donde ya no solamente participa el fiscal o la defensa técnica de la persona imputada, sino que también, o la persona juzgadora, sino que también involucramos un equipo psicosocial que permite dar herramientas a las personas que somos abogadas de que efectivamente esta persona estamos buscándole condiciones para que pueda resolver el conflicto jurídico, pero condiciones que le van a venir a ayudar a la reintegración y que van a permitir atacar esas causas que lo llevaron a estar en conflicto con la ley penal o penal juvenil y que eso va a evitarnos la puerta giratoria. Entonces, este es un trabajo que se hace de forma articulada, propiamente dentro del proceso judicial como tal. Costa Rica tiene la experiencia de manejar o de trabajar la justicia restaurativa como un procedimiento más dentro de nuestro sistema penal y dentro del sistema, dentro de este procedimiento de justicia restaurativa, tenemos lo que llamamos procedimiento de tratamiento de drogas bajo supervisión judicial restaurativa, un poco largo, aquí ponemos nombres sumamente largos a todos nuestros programas y nuestros proyectos, que creo que en eso coincidimos con otras latitudes, pero esto es lo que en otros países se llaman tribunales de drogas o cortes de drogas. Pero lo hacemos con la participación de la víctima bajo los principios y valores de justicia restaurativa, que son muy similares al modelo de ES-CICAD OEA, que es el que seguimos en Costa Rica, que es precisamente la voluntariedad de las partes. No podemos tener un proceso en donde tengamos una víctima directa si la víctima no está de acuerdo en este procedimiento. De igual forma, un principio de responsabilidad activa, responsabilidad de la persona imputada o la persona que se le está siguiendo el hecho delictivo por reconocer que ha causado un daño, pero también por reparar ese daño. Y esto nos permite precisamente trabajar en esa parte socioeducativa con la persona imputada, de reconocer que estamos ante una conducta que no es correcta, que esa conducta me llevó a estar en un conflicto con la ley y que si yo trabajo para eliminar esa conducta, evidentemente voy a cambiar mis hábitos, voy a poder ser más productivo, voy a recuperar mi familia, voy a poder encontrar opciones de empleo y no voy a regresar al sistema de justicia. Entonces, esta metodología restaurativa que la llevamos al procedimiento penal, no solo se trabaja a nivel del Poder Judicial, sino que requiere una articulación interinstitucional y una articulación con la comunidad. Tenemos propiamente en el tratamiento de drogas bajo supervisión judicial unos actores indispensables como son el IAFA, que es el ente rector en salud en el tema de tratamiento de drogas, que trabaja de la mano con el Poder Judicial y que trabajamos de la mano con el ICD, ¿verdad? Que es nuestro ente rector en políticas sobre drogas a nivel del Poder Ejecutivo. Y este trío de instituciones, y como pueden ver, una del Poder Judicial y las otras dos del Poder Ejecutivo, nos articulamos con la comunidad para poder dar este tipo de servicios de una forma mucho más certera. Entonces, por ahí les dejo un poquito la experiencia para ajustarme un poquito al tiempo, creo que ya me pasé, pero si tenemos oportunidad más adelante ya podemos hablar de acciones concretas que venimos haciendo desde lo que es justicia restaurativa. Antes de terminar, nada más decirle que ya no soy fiscal, ahora trabajo en lo que es la Oficina Rectora de Justicia Restaurativa del Poder Judicial, y desde acá lo que hacemos es impulsar la aplicación a nivel nacional de todo lo que es el procedimiento de justicia restaurativa y de tratamiento de drogas bajo supervisión judicial. Muchas gracias, Elisa.
Muchísimas gracias, Giovanna. Perfecto. Entonces nos quedó clarísimo todo recurrido. Muchísimas gracias por explicarnos esta importante y valiosa experiencia. Le paso ahora la palabra a nuestro ponente de Uruguay. Es un placer darle la bienvenida a John Manzi, que es el coordinador técnico de la Dirección Nacional de Apoyo al Liberato, DINALI. Muy bienvenido, John. Tienes el micrófono.
Gracias, saludos a todos. Agradecerte, Elisa, por la posibilidad, y también a Andrea y Diego, acá desde la Secretaría Nacional de Drogas, por permitirnos participar de este espacio. Desde Uruguay, la Dirección Nacional de Apoyo al Liberado es una institución pública que tiene una larga trayectoria en lo que es el trabajo con las personas privadas de libertad. La historia de la dirección data de 1934, en lo que era el anterior Patronato Nacional de Encarcelados y Liberados, que durante todos estos años ha tenido diferentes cambios estructurales y de procesos. El último cambio se dio a partir del año 2021, pasando de depender del Ministerio del Interior, el ministerio que se encarga de lo que es la seguridad pública en nuestro país, a estar bajo el Ministerio de Desarrollo Social, que es el ministerio donde se encuentra todo lo que es el paraguas o la red de lo que son las prestaciones sociales y recursos sociales para las personas en general, y en este caso nada más importante que para las personas que recobran su libertad. Nosotros hacemos un acompañamiento del proceso de los liberados que arranca también en la fase de pregreso. Uno de nuestros cometidos es trabajar y colaborar con el Instituto Nacional de Rehabilitación en lo que es la fase de pregreso, tomar contacto con las personas que están a 6 meses a recobrar su libertad, trabajar en lo que es una fase informativa, en todo lo que es el acceso a las diferentes prestaciones y servicios que pueden acceder cuando recobren su libertad. Tratar de bajar las expectativas y que las personas lleguen a los servicios con un real conocimiento de qué, cómo y hacia dónde podemos acompañar los procesos de reinserción. También de manera individual en aquellas situaciones que tanto las subdirecciones técnicas de las unidades o otras organizaciones sociales que están trabajando dentro de las unidades de privación de libertad pueden detectar y consideran que es importante el acompañamiento y el trabajo con esta persona previa a su libertad. Después que la persona es liberada, se puede acercar a cualquiera de las oficinas que tienen todo lo que es el territorio nacional, la Dirección Nacional de Apoyo Liberado, donde va a tener un referente técnico que va a comenzar un trabajo de acompañamiento en función a cada situación, escuchando un poco las diferentes ponencias, las realidades o las demandas en cierto sentido son bastante parecidas. Las demandas más importantes que tenemos en Uruguay es el tema del trabajo y lo habitacional. Son de las dos grandes demandas que nosotros tenemos. Entonces es importante poder canalizar esas demandas y orientar a los servicios que puede prestar el Estado en este sentido. El tema del trabajo es fundamental, pero para nosotros también es importante poder trabajar todas las dimensiones previas a lo que es la inserción laboral en sí. Muchas veces es más fácil conseguir el trabajo que sostenerlo. Si no hay un trabajo previo, un trabajo de concientización con las empresas, un trabajo de acompañamiento en aquellas que son las primeras experiencias laborales. Hay muchas de las personas con las que nosotros trabajamos que nunca han tenido una capacitación o una inserción laboral en el sistema formal o en el sistema informal. Entonces, el preparar estas personas para su desarrollo y acompañar en este proceso, porque van a haber frustraciones, van a haber problemas, existe estigmatización, discriminación. Entonces, a veces generar simplemente el puesto o la inserción laboral sin tener una contención y un acompañamiento de las diferentes dificultades que se pueden dar en este proceso, muchas veces es llevar al fracaso o a que se den situaciones que complejizan el proceso por el que viene transitando la persona. Hoy hablaban de integración de recursos y de herramientas, creo que era Robin que tocaba esos aspectos. El tema de las herramientas, de las habilidades sociales, prosociales, de las habilidades blandas, es muy importante poder trabajarlo, tanto en la fase de pregreso como en el momento de egreso, cuando tomamos nosotros contacto con la persona. Otro aspecto importante a resaltar es el trabajo con las organizaciones de la sociedad civil. La persona, después que recobra la libertad, transita por la sociedad y tiene contacto con la sociedad y con todas las situaciones que se presentan en ella. Entonces, es importante el trabajo que se puede realizar a la interna de las unidades y que la sociedad civil en su conjunto, las instituciones tanto públicas como privadas, puedan acercarse y trabajar desde el adentro. Si bien acá algo que creo que es gráfico es el hecho de que dentro de las unidades las personas pasan de un sistema de supervivencia a un sistema de convivencia. Y este cambio no es un cambio que se da automático, sino que es importante el acompañamiento y el proceso que nosotros tengamos con estas personas para ir acompasando esos cambios y esos movimientos que se van dando en lo que es la sociedad. Nosotros tenemos una mirada de construcción colectiva, pero desde otro lugar, desde el construir ciudadanía, desde el generar oportunidades y aumentar las posibilidades de las personas. Y es construir desde otro lugar, no desde lo punitivo, sino desde la construcción social y desde el acercamiento de la persona a la sociedad en su conjunto. Entonces, para nosotros es muy importante el trabajo con la sociedad civil, con las organizaciones de la sociedad civil. El acceso a todo lo que es el aparato estatal de prestaciones y servicios que tiene que acceder la persona tanto estando privada de libertad como también cuando recobra su libertad y vuelve a la sociedad. Dos aspectos a resaltar para terminar esta primera parte de la mesa es la generación desde el año pasado, desde mayo del año pasado, nosotros tenemos un programa que se llama Red de Oportunidades. Ese programa lo que busca es acercar a las instituciones de la sociedad civil, tanto empresas como otro tipo de instituciones, que nos permitan la posibilidad de generar puestos laborales en el afuera, pero también que nos acerquen a las personas que están dentro de la privación de libertad. Todo lo que son instituciones, tanto religiosas como del tipo que sea, que están trabajando dentro de las unidades, poder tener contacto con ellas y generar otras alternativas y otras estrategias en conjunto. Obviamente que cada cual en su función o cuáles son los cometidos institucionales, pero generando sí sinergias e interacción en esto, que lo que prima y el objetivo es las personas con las que estamos trabajando, aumentar las posibilidades y mejorar las condiciones en ese sentido. Otro aspecto a resaltar: a partir de diciembre del año pasado empezamos a implementar un programa que se denomina PIA, Programa de Inclusión Asistida, donde tomamos una muestra de 500 personas privadas de libertad. Esas 500 personas, cuando egresan con un beneficio social, que es el programa de inclusión asistida, donde tienen el acceso a una prestación económica durante los primeros 6 meses de su libertad, que tiene determinada contraprestación. La contraprestación es acercarse a las oficinas de DINALI y continuar con un proceso de acompañamiento por los técnicos referentes. Este es un modelo, es un programa que se va a evaluar, y en función a los resultados y a las mejoras que se le pueda realizar, la idea es que pueda universalizarse. Por eso estamos trabajando en una muestra con 500 personas, que va a tener su evaluación durante este proceso y su evaluación posterior, para tratar de considerarlo como una política pública. Acá la importancia de lograr hoy las herramientas. Esto creemos que es una herramienta importante que se puede mejorar y que se debe mejorar, pero acá siempre me gusta hablar de la importancia de lo que es el trabajo y el acompañamiento de las personas, el trabajo y el acompañamiento que podemos realizar los técnicos desde nuestro lugar en estos procesos de reinserción. Bueno, dejo por acá y abierta la posibilidad a intercambio. Gracias.
Thank you so much, John. Thank you for this very important intervention. I'm gonna now go around with a second round, which will address specific questions to each one of our experts. And since we dedicated quite some time in the first presentation, I would really ask you to try to be mindful of the time and concisely respond to the second question. Okay, I'm gonna address to David Best first. You mentioned in your introduction the importance of communities and the stigma. So I would like you to elaborate a bit more on your work in overcoming the stigma and some suggestions that you can provide in this direction. Thank you, David.
Perfect, thank you. And I will try and be really brief. And essentially what I'm going to talk about, much of my work is about recovery capital, and we typically split it between personal, social, and community capital. One of the other unique things about a switch to a strength-based model is the movement away from the idea that the individual is the exclusive unit of analysis to the idea that you can do things at a community level. And there's not really anything new about that. And what I want to talk about is an initiative that Charlotte Coleman, who I'm sure many of you know from the University of Ghent, and myself have been working on for about 6 years now, called Inclusive Recovery Cities. And the idea here really is twofold. For people aspiring to recovery, how can you increase their capacity to access resources and assets in the community? And secondly, how can you manage to reduce social distancing? And our focus has been on public celebratory events of recovery. And basically the idea here is that there's a form of reciprocal altruism. And I was really pleased to hear Monica talk about some of her earlier work about levels of volunteering. But I have been criticized by one of our local recovery organizations for saying it's not giving back. There's nothing to give back for. It's about contributing and actively participating. And so the term we've been using is reciprocal altruism. And some of you will have heard of an idea called recovery-oriented systems of care. Well, recovery-oriented systems of care is a lovely idea, but it's too professional. And the idea of an inclusive recovery city is it starts not with professional organizations, but with grassroots organizations. And the idea that strategic leadership meets grassroots organizations to create a series of celebratory events. And we now have 12 UK cities, 14 cities in the Balkan region, Ghent, Gothenburg, Cape Town, and we're going to launch our first American recovery city in Beckley in West Virginia in March. And it's all predicated on this idea about the recovery community has lots to give and actively participates and contributes and can in fact lead community connection and community engagement. Not simply as an act of generosity from the community, but enriching and enhancing communities. And the idea is every time you have a celebratory recovery event, you celebrate recovery, you celebrate the achievement of it. You create bonding social capital by bringing together people who are in recovery. You create bridging social capital by challenging some of the perceptions and stigmatized ideas of the general public. You create what Chris talked about earlier, visible recovery icons to say, look, this is what happens. This is what it looks like. This is what you should aspire to. It adds to the civic calendar. So it contributes events that the general public, families, communities all can engage in. It allows pathways to active citizenship for people in recovery. Those models are effectively ways of saying, how do we use active community participation to reduce stigma, to build community connections, and to use a criminological term from Robert Sampson, to create collective efficacy through loose social ties and by creating community-engaged activities that start with and celebrate recovery. Thank you, Elisa.
Thank you so much, David. Wonderful. I'm gonna now turn the question to Alicia. She was mentioning before programs and services that task offers, and there are differences among them depending also which kind of settings the clients are living. So I turn back to you. Thank you, Alicia.
Thank you, Elisa. And thank you to the person who posed the question about the gender-specific services. So in our Illinois correctional institution settings, TASK has a model that we will be providing that is both pre and post-release services. There are dedicated teams of staff members, specialized case managers, supervisor, administrator, director, a whole infrastructure built to support this. And we have teams that are behind the walls within the Illinois State correction facilities, and a team that works in community for 6 months after an individual is released. Our post-release service team goes into the correctional facility at the 180-day prior to release date and participates in the staffings that occur, starts to build that rapport and bond with the individual so that the individual knows who they'll be working with in the community, makes certain that everything that is on that individual's supervision plan is understood, is set up, appointments are made in the community, and a lot of information sharing and education given to the individual client that we're working with so that they feel empowered and prepared for that reentry process into community. Our process of the focus of gender specific is very similar to what Chris said in the very beginning of learn from what you're doing, look at your data, see what's working, make changes. Expanding on existing corrections programming that we do. We worked in collaboration with the Illinois Department of Correction and identified an enhancement need at one of our female-specific prisons in Illinois. So we are starting a gender responsive and gender specific program at our Decatur location in Illinois. It will follow similar structure of pre and post release, but we've added an external evaluator to be part of this team so that we can continue to tell the story of what works for the gender specific unique needs of women reentering into communities. we strategically selected 2 different geographic regions in Illinois. One is rural and one is not rural, because we wanted to be able to also evaluate capacity needs, provider needs, what the challenges are specific to each of those geographic represented target areas. And working very closely, there is a set planning process in this where we'll be soliciting and working with individual providers in these set communities who want to work with individuals, but we want to ensure that they have the staff qualifications that are unique to the female specific, the gender responsive women's needs that we're targeting. And those are based in the areas of family reunification, healthcare, childcare, and housing. Mental health and substance use disorders are things that we're currently working with the correction population on in our traditional reentry program, but these will be, our staff will be trained in specific training, trauma-informed, motivational. There will be reunification issues that the staff are trained on to assist our clients when they are working on reuniting with their family members in the community. And again, this will be approximately 6 months after release. The team will continue to work with them in the community. That is not a drop in a if something happens at month 5, month 5.5, where continued support is needed, of course, the case manager will stay with them. But the overall design of that is 6 months post-release that the specialized case management would continue for them.
Thank you so much, Alicia, and thank you also for including in your answer some of the gender aspect that was in previous question. Sure. Wonderful. So I'm turning then now to Monica. In your previous intervention, you mentioned also the importance of the relations with different institutions. So we are particularly interested to how you start and also increase over time the collaboration with the Italian region, Emilia-Romagna, with the Ministry of Education, with the private sector, with other with companies and with other international organizations as us, and also as well about NGOs that are working in the field. So you have a broad range of partnership, and we are interested to know how you build upon during the year to support the residents in their social integration. Thank you.
Thank you, Lisa, for this question. Actually, the funding problem is one of the main problems for NGO who work in the social field, because it is not always easy to have people, institutions, or funds that can provide us with what is necessary to support our people. We know that people have a very low recovery capital. They have low education, they have low level of professional skills. So we need to provide them in order to enhance their possibility to go back to society. What we do, we have involved all the possible stakeholders, so institution, but also company, firms, anyone that can believe that society can be a better place if anyone work and contribute to improve the quality of life of those who are more vulnerable or have multiple vulnerabilities. For example, people who have substance use disorder and also are involved in the criminal justice system have a double stigma, a double vulnerability. So it is very important for them to be able to overcome this situation, which otherwise would leave them marginalized for all their life. So what we do is to create this connection with many institutions that can fund our courses, professional courses, and mainly they come from the European social funds, which can finance professionalizing courses for disadvantaged population. And these people with substance use disorder are in contact with the criminal justice system are among the more disadvantaged population. So it is important for them to receive further opportunities. It was nice, someone talk about the opportunity area, no? The situation in which people can obtain different opportunity in their lives. So they can go to school or they can access to professional courses. But what is important in this work is that we open our community to other people, to stakeholders coming from society. So they enter our community, got to know our people. And this is what Professor Kelly said as the most important thing to reduce, to cancel stigma, is to expose general population to people in recovery. In this way, they can see how they work hard in order to overcome their difficulties, how they are passionate about doing good things, how they can really go through a process of change and be accountable people. In this way, we create also this inclusive and welcoming environment outside the community, because sooner or later these people has to leave the community and to go back to society. So this inclusive and recovery cities David was talking about before comes from a change in the culture of people. People become welcoming towards recovery, they hope also that recovery is possible. They see concretely that recovery happens every day, everywhere. People recovering in many different ways, not only through therapeutic community. We have heard today a lot of services that do a very good job also in different ways. But what is fundamental is to believe and to see, to show that recovery is possible. This way will create a revolution, really a big change, because people will learn that they are welcome and they can make it, they can change. So this is something, it is an exchange of hope, of different hope.
Thank you so much, Monica. I'm gonna turn now to Angela Dixon. She mentioned their experience in Barbados, that they are working a lot with volunteer. And I know that they have a wonderful mentorship program that they develop, and I would like her to address a little bit more on that. Thank you.
Thank you. So with the officers who were attached to the prison, they recognized that while we were that mediating point and assisting them when the offenders came out, they really needed more support within the community. So we developed the Community Pillars Mentorship Program, A New Beginning with a Strong Foundation. So we partnered with the men's and women's ministries of various churches. And it is a pilot project that started last year, and we have absolutely no funding for it. So everybody is doing it out of the goodness of their hearts. Like I said, it's a one-year voluntary program. 3 months before the person is to be released from prison, their mentor goes in and meets with them. They sit down, and over that course of the 3 months, develop their relationship, build a rapport, and also work on what we call the life plan. So that life plan, again, discusses your short, medium, and long-term goals. And the idea is so that the mentor can sit down with them and make sure that their plan is realistic, because recognizing you've been in prison for such a long period of time, you're coming back expecting that things are the way that they were before you went in. So the mentor is there to help them to be realistic with their goals and their plans, and the basic things that they need, like being able to have an email address, using an ATM machine, getting a new ID card, all of those basic things that they're there to help them and support them with. We also organize monthly group sessions for the mentors and the mentees. They come to the department and we sit down and we listen to their issues and challenges that they would have been encountering since they've been released. It's also an opportunity to network. And it's also an opportunity for us in the department to be able to assist them with some of the challenges that they're having. So for instance, we had our meeting last Saturday, and one of the previously incarcerated persons had been trying to open a bank account. And he said that when he went to open the bank account, his record came up on the screen, and the lady was like, well, I'm going to have to take this to a higher level. So we were able to contact the bank, and we now have a relationship with them. So any of the persons who come out who come out and are ready to open an account, we have a representative that we will now send them to, so they won't have to go through those issues and challenges that person previously did. We also have a WhatsApp support group for the mentors. So that's an opportunity when they're having issues and challenges with their mentees and are not quite sure how to deal with it, or they may decide they want some additional support and training with dealing with some of the issues that the person is encountering. Then we have resource persons that we will organize a session for them as well. And because this is new, and in the Caribbean, we don't usually monitor and evaluate things very well, we made sure that we included that component in it. So the mentors are doing a monthly survey for us. It's a simple, short survey. I think it's like 10 questions, and they shoot that back. And then because of the literacy skills that we are encountering with some of the mentees, what we did is we did organize the baseline survey, and that's something that the mentor and the mentee will sit down and do at the very beginning. We'll do a midpoint, which again is like a 5-6 questions, simple yes, no, and then we'll do a final one at the end. And that's it.
Thank you so much, Angela. Me voy a cambiar al español y le voy a formular la pregunta a Joana Calderón de Costa Rica. Ustedes tienen y han apostado por una ley muy innovadora en cuestiones de género en Costa Rica en alternativa penal. Y nos gustaría que pudiese elaborar un poco sobre esto para igual responder al interés de los programas que están dirigidos para mujeres. Muchas gracias, Joana.
Gracias, Elisa. Bueno, en Costa Rica, no solamente relacionado con el tema de género, sino que también aprovecho para comentarles que a partir del año 2019, enero del 2019, entró en vigencia la Ley de Justicia Restaurativa, que es la que nos permite trabajar con esto que inició como un programa, ahora como un procedimiento, como se los contaba anteriormente. Y dentro de esta ley se estableció el tratamiento de drogas bajo supervisión judicial, tanto como una condición para una salida alternativa, como también como una pena alternativa como tal. Entonces nos permite trabajar este abordaje integral en las etapas de investigación del proceso penal, o bien durante la etapa intermedia para no llegar al debate, o incluso en el propio debate para imponer una pena. Y de la mano con esto, hemos iniciado a darle un mayor enfoque al tema de género en razón de que tenemos unas reformas también del año 2019 a nuestro Código Penal que permiten a la persona juzgadora hacer una valoración cuando se trata de una mujer que ha sido ampliado a persona por nuestra Sala Constitucional este análisis, pero inicia, ¿verdad?, hablando de que cuando se trata de una mujer que se encuentra en una condición de vulnerabilidad y nos da ciertos aspectos que la persona juzgadora tiene que valorar. Esto permite entonces que se pueda hacer una disminución en la pena de la persona que está llegando a cometer un hecho delictivo en razón de esas condiciones de vulnerabilidad en las que se encuentra, entre ellas pobreza, tener a cargo el cuidado de otras personas menores de edad o adultas mayores, por ejemplo. Y unido a esto también, nuestra ley 8204 tuvo una reforma en cuanto a la introducción de droga en centro penal por mujer en condición de vulnerabilidad. Entonces, este preámbulo un poco más jurídico, ¿verdad? Se me sale ahí la profesión y en lo que trabajo directamente en el Poder Judicial. Entonces, este preámbulo más jurídico lo hago para poder comprender que tenemos un margen de acción que nos ha permitido esta apuesta que ha hecho Costa Rica desde su legislación para trabajar en la alternatividad al encarcelamiento en cierto tipo de población que tiene condiciones de vulnerabilidad que las llevan a la comisión de hechos delictivos. Y entre esas tenemos una serie de mujeres que incurren en el consumo de drogas y también hacen de su modo vivendi el tener que introducir drogas a centros penales para poder incluso darle de comer a sus hijos o para poder tener la manutención en su casa o incluso porque están en ciclos de violencia intrafamiliar o violencia de pareja. Entonces, estamos impulsando acciones para poder trabajar directamente en el tratamiento de drogas bajo supervisión judicial con este tipo de mujeres, con un enfoque dirigido total y completamente hacia las mujeres. Y aquí tenemos una gran interacción con una red interinstitucional que maneja el Instituto Nacional de las Mujeres de Costa Rica, que es dirigida a mujeres que se encuentran en conflicto con la ley penal precisamente y también para los familiares dependientes de ellas. Entonces, esto nos permite a nivel interinstitucional poder tener mejores oportunidades para este tipo de mujeres que se ven involucradas en un proceso penal y con consumo de drogas a raíz de estas condiciones en las que se encuentran. Sabemos que, por supuesto, hablando en el tema de mujeres, no tenemos una mujer, sino que tenemos mujeres con diferentes circunstancias, desde las afrodescendientes, indígenas, migrantes, ¿verdad? También mujeres en diferentes situaciones de pobreza, educación, cuidado generalmente de otras personas que dependen de ellas. Entonces, en este momento el país viene impulsando acciones hacia este tema específico. No quiero dejar de mencionar, porque por ahí vi una pregunta de Sofía y un abrazo y un saludo para ella muy caluroso, que también trabajamos con personas menores de edad, lo que es el tratamiento de drogas bajo supervisión judicial restaurativa o el procedimiento de justicia restaurativa. Muchísimas gracias, Elisa, por dejarme ampliar sobre este tema tan importante.
Muchísimas gracias, Giovanna, para todas tus aportaciones. Ahora le doy la palabra a nuestra última intervención, a John Mansi del DINALI de Uruguay otra vez, para que nos pueda un poco detallar en la síntesis cuáles han sido los retos más destacados y las barreras y también sus alcances. Hemos visto que el DINALI tiene un gran historial que han ido cambiando, modificando, respondiendo a diferentes necesidades. Entonces, si nos puede destacar alguna de estas, sería importante para las compañeras y los compañeros que están participando. Muchas gracias, John.
Bueno, muchísimas gracias, Elisa. Creo que uno de los grandes desafíos es el generar conciencia en la sociedad en general y sobre todo también en las empresas en la importancia de generar condiciones y aumentar las posibilidades de inserción para las personas con las que nosotros trabajamos en un sentido amplio. No solo en lo laboral, sino en todo lo que es la construcción de ciudadanía y los diferentes procesos que realizan las personas. Algo que comentaba Ángela, en el tema de las barreras que se encuentran muchas veces a la hora de realizar diferentes trámites. Eso también genera mucha frustración, genera mucho desistimiento a veces en los procesos en función a estas barreras. El simple hecho de, como comentaba Ángela, generar una cuenta bancaria, de acceder a la documentación, generar determinados procesos que son importantes a la hora de la reinserción o del ingreso o del pasaje por las diferentes situaciones que hacen a lo que es la sociedad en general. Creo que eso es una de las grandes dificultades o desafíos que tenemos, el de construir procesos y entender la situación del otro desde el lugar en el que se encuentra. Desde dónde viene, la historia que lo ha atravesado, las diferentes frustraciones y situaciones que ha atravesado su vida. Entonces, generar conciencia en ese sentido es fundamental e importante, y también entender que los procesos que realizan las personas con las que trabajamos son procesos que pueden tener idas y vueltas, que van a haber dificultades, que van a tener problemas. Entonces, verlo desde el lugar de la oportunidad. Cada situación nueva que se presenta o cada desafío que se presenta es una oportunidad para poder mejorar y aumentar las posibilidades de que las personas se puedan a lo largo del tiempo sostener y mejorar como cualquier persona. Entonces es fundamental eso, la conciencia y el tratar de verlo desde las posibilidades que tiene. muchas veces tendemos a ver desde las dificultades que ha tenido y los errores que ha cometido. Entonces tratar de ver desde eso, desde la posibilidad, desde las características que tiene y la fortaleza que tiene la persona. Otro desafío es generar también políticas públicas que trasciendan los momentos institucionales o que trasciendan los periodos administrativos, sino que se pueda llegar a procesos de políticas que sean de encuentro entre los diferentes partidos o administraciones que puedan trascender los gobiernos y generen mayores posibilidades para las personas. Y también el poder sistematizar y generar insumos en función a los diferentes programas que realizamos. Tener la posibilidad de evaluación y ver de qué manera mejorar esos programas y transformarlos en políticas públicas de larga data y que faciliten y ayuden a los procesos en los que estamos trabajando. Gracias.
Muchísimas gracias, John. Muy interesantes todos esos puntos. Antes de concluir, tengo dos preguntas más que nos han llegado por el question and answer y también por otros medios. Tengo una pregunta y está abierta a quien quiera contestar. El papel de las instituciones locales, alcaldías, cómo han influido en su capacidad de diseñar o de apoyar los programas de reinserción social. Si alguien quiere responder de los ponentes. John,
Bueno, tal vez
por
les
favor.
cuento.
John y
Gracias.
después Giovanna. O Giovanna y
Perfecto.
después John.
Sí, mira, nosotros creemos que es fundamental. Nosotros tenemos algunas experiencias de trabajo con varias instituciones públicas. Nosotros tenemos una ley de pasantía que lo que nos permite es la contratación de personas que han transitado por procesos de privación de libertad y desde hace muchísimos años, desde el 2011, si no me equivoco, 2010-2011, tenemos el acompañamiento de diferentes instituciones públicas que reciben a las personas en procesos de reinserción. Son pasantías dentro de la formalidad, con todos los beneficios sociales y demás que tiene cualquier trabajador. Y esto ha sido muy importante, el poder generar posibilidades de acceso a capacitación, de generar historia laboral formal, de tener primeras experiencias de trabajo y de tener experiencias de trabajo protegido, por llamarlo de alguna manera, que nos genera como un trampolín en este proceso para después tender a lo que es la autoinserción en el mercado laboral. Este proceso de pasantía no es un proceso donde la persona se encuentra sola, sino que existe el acompañamiento del equipo de DINALI en este proceso, tratando de generar otras oportunidades en el tema de lo que es la capacitación, el acompañamiento de todo lo que es los procesos laborales, no de la tarea en sí, sino de todo lo que trae consigo el desarrollarse dentro de un lugar de trabajo, lo que es si me enfermo, cuáles son los trámites que tengo que realizar, cuáles son las gestiones que tengo que realizar, cuáles son los beneficios a los que accedo dentro de lo que es el trabajo formal, y tratar de desmitificar eso de lo que es el trabajo informal. Entonces, apuntar a la formalidad, a la generación de historia laboral y de capacitación para la posterior autoinserción en el mundo del trabajo. Así que creo que todo lo que
Muchas
es
gracias, John. Perfecto.
Gracias.
Le damos la palabra un minutito a Giovanna para que pueda responder igual a esta pregunta.
Gracias. Bueno, nosotros en Costa Rica, la misma ley de justicia restaurativa nos da la posibilidad de conformar una red de apoyo interinstitucional y también con organizaciones no gubernamentales. Y sí lo hacemos desde un ámbito de mucha formalidad, iniciando, bueno, voy a hacer una diferencia, que es lo del trabajo que hacemos en tratamiento de drogas, donde les decía que está el ICD, el IAFA y el Poder Judicial. donde tenemos una comunicación muy fluida, reuniones establecidas durante todo el año, tanto desde los jerarcas como desde las personas que coordinamos propiamente el tema. Y esto nos permite entonces llevarlo a buen puerto, pero tenemos que interactuar con el resto de la institucionalidad y con el resto de las organizaciones no gubernamentales. Entonces, desde ahí iniciamos con un trabajo de mucho convencimiento, de mostrarles los números, los resultados, de tratar de evitar esa estigmatización que se tiene. Y después sí se firma y se hace algo muy formal, que es un acuerdo interinstitucional, para poder que esa organización pertenezca a la red y también tener responsabilidad desde el Poder Judicial y los equipos interdisciplinarios de justicia restaurativa de quienes estamos remitiéndoles y ellos de comunicarnos cómo va la situación con esa persona. Entonces, esa es más que todo la interacción que tenemos. Muchas gracias.
Muchas gracias, Giovanna. Y tengo igual una última pregunta, que es una pregunta muy puntual sobre un aspecto específico y la voy a dirigir a Alicia de Task. Me están preguntando cómo manejan ustedes, si es necesario, la transportación de los clientes, cómo han organizado, dice como que los van acompañando, los van recogiendo, quién proporciona este servicio y cómo lo manejan. Muchas gracias, Alicia.
Thank you for the question. So we have found that transportation is really an essential element to address and do it as proactively as we possibly can, because there's so many opportunities for a missed next step there. So when people are leaving our county jails and going to residential treatment setting, we try as much as possible to have the case manager who has already assessed them and is assigned to continue to work with them is the actual person who will pick them up and bring them to that residential setting, be with them through part of the intake and ensure that they have engaged in where they're supposed to be. In some of our programs, and it depends on geography across the state and sort of volume of referrals, an example is in our Cook County programming, we have 2 different vans that we utilize. So we do consolidated staffings, as was just mentioned by Giovanna, with our jail partners and or our Illinois Department of Correction partners, and get it's easier on the institution correction side because we know the time that they will be released. That is a much more coordinated release. Our jail population is very hard to manage around, but we have a phone call that comes to one of 2 people in our Cook County office, and we dispatch a van. We try with court release times that we know. We ask the system to get that to us 3 days in advance so we can consolidate and coordinate the travel schedule and work with community SUD providers to make certain that they'll intake the individuals when we come with them. We also, in our transportation, as much as possible, we try to also incorporate another element that could be a barrier, which is medication pickup for our individuals, so that they are arriving at their next juncture of care with whatever psychotropic or primary medical medication that they have prescriptions for, so that they're entering the next point of service with the essential medicines that they need to sustain. And in all future grants that we write or programs that we design, we really put transportation up front. We also have some programs that utilize Lyft and or Uber agreements, so that we're trying very hard to remove those barriers to the transportation piece.
Muchísimas gracias, Alicia. Y hemos llegado por razones de tiempo al cierre de nuestro webinario, pero quisiera invitar a todos los participantes en poder responder unas preguntas y voy a lanzar, son solo 2 pequeñas preguntas, pero nos ayudan en la evaluación del webinario. Hemos destacado cuánto es importante evaluar lo que hacemos, entonces aplicamos esta buena práctica y le pedimos que por favor nos puedan apoyar con sus respuestas. Es muy importante. Muchísimas gracias para responder a esto y pues muchísimas gracias igual a todos los panelistas. y es un gran placer para las palabras de cierre darle la bienvenida y el micrófono a Antonio Lomba, que es el jefe de la Unidad de Fortalecimiento Institucional de la SE-CICAD. Antonio, muy bienvenido. Tienes la palabra.
Muchas gracias y bueno, qué lujo de jornada. Yo sé que están ustedes cansados ya y cansados. Es la hora de almorzar en muchos sitios, o sea que voy a ser muy breve. Bueno, en nombre de la Secretaría Ejecutiva de la SE-CICAD, gracias a todos los panelistas y a todos los participantes. La verdad es que, bueno, he estado viendo y participación de muchísimos de los Estados miembros de la OEA y fuera de la OEA también, así como de diferentes organizaciones. Gracias por el tiempo que dedican todos ustedes una mañana entera a este debate. La verdad es que yo he quedado impresionado de cada una de las participaciones, ¿no? Yo creo que estarán de acuerdo primero en la diversidad de los enfoques y la altísima experiencia desde tan diferentes ángulos, ¿no? Para ver el proceso de integración social para personas en conflicto con la ley principalmente, ¿no? Pero realmente hay una palabra, Mónica, me voy a quedar con la palabra que dijiste de la dimensión del cambio. Yo creo que abrimos la puerta a hablar mucho más sobre la dimensión del cambio. Espero que este sea el primero de otros muchos webinars y de debates, de mesas redondas, de discusión. He aprendido mucho de muchas de las cosas que se han presentado y espero que todos y todas ustedes hayan también pues se beneficien de este tipo de eventos. Desde la Secretaría Ejecutiva de la SE-CICAD de la OEA realmente es un placer organizar este tipo de debates y abrir siempre el foro de discusión para temas presentes y emergentes. Elisa, un millón de gracias por la moderación y por coordinar este panel tan brillantemente. Santiago por todo el apoyo también. Y bueno, como no, David, Robin, Alicia, Mónica, Ángela, Giovanna y John, gracias de verdad por vuestra participación en la jornada de hoy. Que pasen un buen día y muchísimas gracias.